Hi, good morning, and thank you for joining us for the Explore Autism Conference. My name is Jenny Morris, and I am the Associate Director for the Autism Support of Alabama. Alongside me are my fellow team members, Melanie Jones, the Executive Director, Shanique Jeffress, our Program Manager, and Anna Maple, our Project and Fundraising Manager. We have been preparing for this virtual conference for months, and we are excited that it's finally here today. We are honored to host this amazing lineup of speakers to whom we will introduce individually. Let me say that we are proud to be touching on subjects such as taboo topics with Dr. Stephen Shore, challenging behaviors with Dr. Sarah Bowman, visual supports for hygiene and sexuality with Dr. Whitney Mead, and bullying prevention with Dr. Carrie Magro. These are pressing issues that are affecting many individuals. We believe this information shared with you today, along with your handouts, can impact your lives of those that you support. We know your time is valuable, and we're grateful that you joined us today and look forward to your feedback. Your participation is vital in fostering education and understanding and support of the autism community. At the end of each session, our moderator will choose a few questions as time allows from the chat for the speaker to answer. After each speaker, we will have a 15-minute break. At this time, I am excited to introduce Dr. Whitney Mead. Dr. Mead holds a bachelor's and master's degrees from the University of Alabama. She also holds a doctorate from Auburn University. Her work has been in both the K through 6 and 6 through 12 education. Most recently, she was an assistant clinical professor at the University of Alabama in Huntsville, and she is currently a middle school English language arts teacher in North Alabama. I am pleased to introduce Dr. Whitney Mead.
Thank you very much. So I have taught lots of places and done lots of different things, but one of the things, I can't share my screen. One of the things that I have really become interested in the last few years is topics of hygiene and sexuality. And some of that's because some of those babies I started teaching 25 years ago are now young adults and adults and are facing different struggles as they have aged. And so as soon as I can get my screen, we will get started. Thanks for being patient with us. We're trying a new platform to be able to reach more people in a broader arena. And so we're got a little hiccup here. Hold on 1 second.
Hello, everybody. I just want to thank you for your time today and your patience. We have obviously had some technical difficulties with our two platforms of Zoom and Eventbrite. We feel like we have them solved now. And so we are going to do a small tweak with our itinerary. So whereas Dr. Whitney Mead should be speaking right now, we are moving Dr. Mead to the 2 o'clock time. So we have our closing remarks at 2 o'clock right now. And so we will have Dr. Mead from 2 until 3 o'clock. And so all of this is being recorded. So if those of you that cannot change your schedules, and are unable to listen to Dr. Mead, we will have that for you that we can send out. And so you will not miss Dr. Mead's message because it is very important and it's riveting. So we're going to get started right now, and our change in itinerary will have us starting with Dr. Sarah Bowman. And she is still going to run her speech until 11:15. And then our itinerary that we posted will just continue from there. And anyway, we'll get started now. My name is Jenny Morris. I am the Associate Director of the Autism Support of Alabama. Thank you all for joining us today for the Explore Autism Conference. Alongside me are my fellow team members, Melanie Jones, the Executive Director, Shanique Jeffress, our Program Manager, and Anna Maple, our Project and Fundraising Manager. We have been preparing for this virtual conference for months, and we're excited that it's finally here. And again, we are thankful for your patience today. We are honored to be hosting this amazing lineup of speakers to whom we will introduce individually. Let me say that we are proud to be touching on subjects such as taboo topics with Dr. Stephen Shore, challenging behaviors with Dr. Sarah Bowman, visual supports for hygiene and sexuality with Dr. Whitney Mead, and bullying prevention with Dr. Carrie Magro. These are pressing issues that are affecting many individuals, and we believe this information shared with you today, along with your handouts, can impact your lives or those that you support. We know your time is valuable, and we are grateful that you joined us today and look forward to your feedback. Your participation in this is vital in fostering education and understanding in support of the autism community. At the end of each session, our moderator will choose a few questions as time allows from the chat for the speaker to answer. After each speaker, we will have a 15-minute break. So let me get started today by introducing you to Dr. Sarah Bowman. Dr. Bowman is the co-founder of the Alabama Developmental and Behavioral Specialists and Psychological Clinic in Hoover, Alabama. Dr. Bowman is a licensed clinical psychologist who provides outpatient treatment and assessment for a wide range of clinical concerns in children and adolescents, including anxiety, depression, disruptive behaviors, ADHD, and adaptive skills deficits. She has specialty training and expertise in the area of neurodevelopmental disabilities. I am pleased to introduce you to Dr. Sarah Bowman.
Hi, everybody. Just want to make sure that y'all can hear me. Am I a go, guys? I'm going to assume yes. Okay. Somebody let me know if this is not showing up, but hopefully y'all are seeing my slides. Very excited to be here and to talk about challenging behavior. So I will dive right in. Okay. So my outline today, I'm going to be talking about kind of a better understanding of challenging behavior, maybe the framework, if you will, through which you can look at it from an evidence-based perspective, response, so helping to tailor our reactive kind of interventions to challenging behavior, and then as well prevention. So how do we attempt to prevent those challenging behaviors? So objectives include gaining a really good understanding of the ABCs and functions of behavior, helping to increase your familiarity with common behavioral terms that you may hear elsewhere, improving your knowledge of how to respond to challenging behavior based on its function. The idea of equipping y'all with practical strategies for implementing preventative interventions, and then just reviewing common problems to avoid. So hopefully you don't fall into those pitfalls. So let's get started. Okay, so we're starting with some understanding. So first things first, let's talk about the ABCs. So A stands for antecedent, B stands for behavior, and C stands for consequence. So behavior is anything that can be observed and measured. So with that, the more specific we can be, the better. So rather than saying, for example, tantrum or meltdown, which could encompass a variety of specific behaviors, we might instead say falling to the floor, hitting with a closed fist, biting, that kind of thing. So that way we know we're talking about the same thing. And also we can be a little bit more precise with tracking progress, making sure that we're improving on things. Ideally, we want things to be positively stated. So for example, running versus not walking, or yelling versus not using your inside voice. But it essentially, behavior kind of describes what does it look like, what does it sound like, how often is it happening. The antecedent, the A, occurs immediately before the behavior. So that is, you might think of it as kind of a triggering situation or the context within which the behavior occurs. So who was there, who wasn't, what kind of activity was happening, or was the person unoccupied? If they were occupied, is it with something preferred or non-preferred? Are there any sensory kind of concerns that come into play? What time of day was it? Is the person on medication? Is it before that's come on board or after it's wearing off? Was a direction or a command given? Was there a request made that was denied? What are the expectations for behavior, and were those made explicitly clear? Those are some things to consider with the antecedent. Consequence, the C, occurs immediately after the behavior. So was a need met? What was said? What other kind of forms of attention might have been provided? Was there eye contact involved? Did we have a really big frustrated reaction and facial expression? Did the individual get access to something they didn't have access to before? Or did they escape or avoid something? So those things are pretty important. We'll talk more and kind of come back to that as we go. But one thing to think about is that the consequence ties into the function. So you'll notice my questions, kind of what was said, what other forms of attention, did they get access, et cetera, will come up when we're talking about the functions of behavior. So I always like to illustrate this using a vending machine, because who hasn't seen and operated a vending machine? So ABCs for that would be, antecedent, kind of the setup. I'm hungry or thirsty. I see a vending machine. There's one available, and I have money to purchase something. So the behavior, the things that other people would be able to see and measure, I put my money in, I press the buttons, right? And then consequence, what comes after is getting and consuming my treat. So, I'm getting something saying that people can't see my slides. Is that? Oh, we cannot see your slides. Okay, so how do I? Oh, goodness. Sorry about that. Okay, let me share. Sorry, guys, that was a little frustrating. However, let's see, let me go back. Okay, good thing I have extra time, huh? Challenging behavior. Thank y'all for staying tuned, even though you couldn't see my slides. Objectives today, helping y'all to understand ABCs and functions of behavior, giving you a better idea of some common behavioral terms, improving your knowledge of how to respond to the challenging behavior based on the function, helping to give you strategies to prevent challenging behavior, and then also kind of letting y'all know of some common problems that you can avoid, hopefully. So outline, we'll talk about understanding, and then response, and then prevention. Okay, so understanding. Antecedent, behavior, consequence. Those are the ABCs. So the behavior, the B, can be observed and measured. We want to be as specific as we can. So we know we're talking about the same thing. We can monitor when we're making progress. So that would be rather than tantrum or meltdown, it might be falling to the floor, hitting with a closed fist, biting, that kind of thing. Okay. The antecedent, the A, occurs immediately before the behavior. So that you might think of that as the triggering situation, or kind of the context within which the behavior occurs. So who was there, who wasn't, what was going on, were there sensory kind of considerations to think about? If they were involved in an activity, was it preferred or unpreferred, or were they unoccupied? What time of day was it? That's especially helpful if the person that you're taking data on is taking medication. So you can will likely see more challenging behavior before the medication takes effect and as it's wearing off. Was a direction given or command given? Was a request denied? You know, what are the expectations for the situation? Were those made explicitly clear? Consequence occurs immediately after the behavior. And that ties into the function. So was a need met? Was attention provided? Did the person get access to something or avoid something? Okay. All right. So vending machine, kind of thinking about the ABCs in this context. Antecedent would be hungry or thirsty, see a vending machine, put the money in, press the buttons that I want, and I receive my treat, I consume it, I'm no longer hungry or thirsty. So keep in mind, you know, that's kind of our typical sequence with a vending machine. But I want you to think about what happens when somebody's hungry or thirsty, they see a vending machine, they have money, put it in, press buttons, and nothing comes out. So in all likelihood, you've observed this happening before. And typically what we see, even with adults, is an escalation in behavior, right? We see people kicking the machine, they're cursing, they're trying to rock it back and forth, they're sticking limbs up in the machine to try to get their snack. So just we'll get back to the term for that in a little bit, but when we don't get that expected consequence, we see kind of a up the ante with behavior. It escalates in an attempt to kind of get back to the status quo. So, okay. How do we figure out the ABCs and the function? Well, we take data. So this is kind of a behavior log that you might see, date and time. I find day of the week a little bit more helpful because that helps me orient to certain activities that might be going on, might see patterns around, also the time. Here's the antecedent, what happened right before, behavior and duration. So again, being as specific as we can, the consequence or what happened right after, how I responded, and then the function. So, okay, let's talk about the functions of behavior. So you could really think of this a few different ways. I prefer the kind of seat where we divide up the functions into 4, but there are others who prefer to kind of collapse them into 2, escape and access. I think you get a little bit more data with having 4, so that's what I prefer, but again, you can do what feels right for you. If we're thinking about it in terms of 4, the acronym SEAT is helpful. So the S stands for sensory function or internal need. A bit of a hint with that is the individual engaging in the behavior when they're alone? And if they are, chances are it's a sensory function or internal need. There's nobody to provide attention in that case. There's nobody to place a demand or to provide access to something that we don't already have access to. So in that case, we can kind of bet that it's going to be a sensory function. The E stands for escape or avoidance. So chances are if there was a demand placed or command given as part of the antecedent, that if challenging behavior follows, probably escape motivated or avoidance motivated. The A stands for attention. So keeping in mind, attention is an extremely powerful reinforcer. So much so that it doesn't matter what kind of our perceived, whether we perceive it as positive or negative, personally, it's going to be reinforcing. It's going to make behavior happen more frequently. So we really need to be extra mindful of that and make sure that we are attending more to the appropriate behavior than the inappropriate. If we're thinking about kind of challenging behavior being running, more appropriate behavior being walking, if I'm catching my child being good, let's think pool in the summer, thank you for using your walking feet versus don't run. So if I'm praising walking feet and walking feet are happening more frequently, by necessity, by definition, running is happening less frequently. And then the T stands for tangible item, access. So you could think of that as access to a desired object or activity. Chances are if a request was made and then denied, and we have challenging behavior that follows, it's probably a tangible item function. Okay, so I'm not going to necessarily wait for people to respond in the chat. I want to be mindful of time, but I do want to give you some examples of this in action. So let's say a child is crying, they're repeatedly hitting the kind of bubblegum machine or small toy machine outside of a store, and a passerby gives this child a quarter. What do we think the function of the hitting of the bubble gum was? So sensory internal need or escape or avoidance, attention, tangible item access. Well, we can probably guess that the initial function was for tangible item access, right? She's wanting this bubble gum. However, she did get some attention from this passerby. So that's something that does come into play. I do think it's important to know that it's not always cut and dry where there's just one function per the behavior. Maybe that it starts out for one function, but then others come into play and it could be maintained for a different reason. Okay, so what about the child who starts to reach for the electrical outlet? Mom notices and says, no, 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 don't touch that. But, and you may have seen this before, I certainly have, instead of stopping, the child looks at you and they smile and then they do it anyway. Why do we think that function, the function of the behavior was? Well, you know, a demand was placed, right? Don't touch that. But also we provided attention. And then the child continues to do what they're doing and they look at us and smile as if it's a game, right? So there's a few that are coming into play here, but in terms of the consequence and kind of tying into the function, that would be more attention motivated. So let's see. What about if you're on the playground or your child's on the playground, you're saying, hey, it's time to leave, let's wrap it up. And then in response, your child climbs up to the very highest point on the playground equipment and just keeps playing. So a demand was placed, and then now we're having kind of challenging behavior, ignoring, refusal to comply. So probably an escape or avoidance function. In the case of a child biting her nails while working on homework, you know, could be by herself, maybe by herself, sitting there. You know, we're not providing attention, no demands are being placed. So probably a sensory or internal need function. In general, a lot of times those body habits, biting nails, kind of skin picking, jiggling our legs, often are sensory or internal need related. Okay, so this is kind of a fun video that I wanted to show y'all. And it really does a good job of illustrating attention-seeking behavior. Now, I don't necessarily think that every child is doing exactly this, but it is a really fun video and it does a good job of showing this. So we've got some crying, we've got some rolling on the floor. But wait a second. Still little frustrated noises. Oh, now you can see me again. Crying, rolling on the floor, looking at parent. Parent ignores, walks on by. Okay, so you can get the gist. Our kiddo is really kind of attention motivated, right? And when there's nobody to provide the attention, we relocate so that we can kind of attempt to get that. All right, so few important terms to know and remember. Reinforcer or reinforcement. Something is a reinforcer if it causes the behavior to happen more frequently. So different people would be reinforced by different things, depending on their likes and dislikes. Selective or differential attention. So we're wanting to selectively attend to appropriate behavior more frequently than inappropriate behavior. Planned ignoring is kind of the flip side of that. We would like to planfully ignore disruptive or challenging behavior as long as it's not dangerously aggressive or destructive. In that case, we can maintain safety while still minimizing the attention that we're paying. So don't necessarily have to make eye contact or say anything while we're maintaining safety. Extinction burst is what we were talking about when we referred to the vending machine where we're not getting our treat. And so we see this escalation in behavior in an attempt to get that expected consequence. Good news is that means that it's working. It doesn't mean the opposite. And if we're consistent, nobody is going to continue to put their money in and patronize a vending machine that remains broken, right? So provided we can consistently ignore and or block the function from being met, the behavior will eventually extinguish. Applied behavior analysis. So that would be kind of all of these principles that we're talking about today, ABCs, functions of behavior. You may have heard of an FBA, functional behavioral assessment. Frequently, I think we hear about these in school or in ABA clinics where basically those behavior logs are completed, observations are made to assess the function of the behavior and to make a plan, so a behavioral intervention plan for how to address it, how to intervene. Okay, so I have had parents ask me before or kind of lament, like, I wish there were just one way that we could respond and we would just know this is what we do. And that would be that. And that would be really nice. But it's unfortunately not that easy. However, we want to look back at the data, and that makes it a little bit easier. So with our data sheet, the consequence is where we would look to kind of determine, is our response appropriate? Is it making sure the function's not being met? If not, what can we adjust so that that's the case? So one, I guess, more general kind of thing to remember is to respond in a way that does not meet the function. So for example, with a behavior that is done for a sensory or internal need purpose, the tricky part of that is that it's what we call automatically reinforcing. So just performing the behavior meets the function. So it is a bit trickier to change, but it's not impossible. We can replace the behavior with a more appropriate one if it's problematic or dangerous. And kind of the way that we would do that is habit reversal training. So part of that is identifying triggering emotions and situations. So kind of those antecedents. In general, distressing emotions, stressful situations, or kind of more sedentary activities where somebody's unoccupied, things like TV or sitting in the car, listening to a lecture. We tend to see those more frequently trigger these kind of body habits. Ideally, we want to decrease access to the body part or the inappropriate item if it's applicable. We want to teach a more appropriate alternative behavior. So, for example, this might be mouthing or chewing on non-food objects, for example. So it could be that that they're chewing on clothing. It could be just random objects that they pick up. It could be something really dangerous, like cords. So, depending on how dangerous or problematic it is, you may or may not want to intervene. But if you do, thinking about, okay, if this function is kind of to get some sensory input, what is a more appropriate way to do this? With our mouthing example, it would be to kind of mouth or chew on things that are meant to go in your mouth, right? So it could be a chewy tube, it could be some gum, could be a sucker or something like that. So if I am unbuckling my child from her car seat and I notice that she has put a small marble in her mouth and is kind of rolling it around, what I would do is kind of block her from doing that. So take it out without really saying anything, making eye contact, paying it a lot of attention. I would then prompt her, probably by holding it up to her mouth, to chew something more appropriate, like a chewy necklace or a chewy tube. Once she starts doing that, then I can provide that reinforcement, the praise. Oh, thank you so much for using your chewy tube. That's much safer. I really like that you're doing that. Now, a key piece of this is making sure that that appropriate item is highly visible and easily accessible. Because if it's easier to just do the body habit, then that's probably going to continue. So we want to make sure that whatever we're trying to redirect them to is really easy to access. So for example, that might be like a necklace versus having to keep track of a chewy tube that otherwise we might sit down and leave. Okay, so what about challenging behavior that's escape or avoidance motivated? Well, obviously, we don't want the function to be met, so we don't want them to escape the demand or avoid it for an extended time. Here is a good example of why one response is not appropriate across the board. If timeout is kind of a parent's go-to discipline strategy, then that really is not helping us in the case of escape or avoidance motivated behavior, because we're really just playing into that, right? And allowing them to avoid for longer. So instead, we can use prompting, which could be physical prompting or hand over hand, as needed to facilitate compliance. And we can be flexible in terms of our kind of standards or expectations as to the quality or duration or independent completion of this behavior. So if we're wanting them to go into bath and they're kind of not really cooperating and we're kind of hurting them there, physically prompting them into the bathroom, we can provide positive attention for that. They may be whining, but we can ignore that. And we can compliment them on following directions and moving into bath. We can use a visual timer also to convey those expectations for how long this is expected to occur. I don't have this on my slide, but choices are also a really nice way of providing some control to the individual. Okay, thanks for going into bath time. Do you want your bath foam or do you want to choose some of your bath toys to go in there with you? And that provides a little bit of kind of this feeling of like, okay, I have to do this, but at least I'm in control of what's going in there with me. Okay, attention motivated behavior. So attention is not just kind of a verbal response, but it's also those nonverbal behaviors. So that is important to remember. It is extremely reinforcing. So ideally, we're minimizing attention to the inappropriate behavior, using planned ignoring, and then blocking and redirecting to a more appropriate behavior. Okay, so we're kind of selectively attending to the appropriate behavior. So that might be through labeled or specific praise. And by that, I mean not just a thank you or a good job, but thank you for following directions. Good job for listening, which tells the person exactly what they did that was good so that they have a better chance of doing it again. And then timeout is a strategy that is essentially removal of any attention or access to tangible items or activities. So timeout in response to attention-seeking behavior would be appropriate, right? Because we're blocking or denying attention, other than kind of a minimal, stay in the timeout chair until I tell you to get up or something equivalent. Okay, so what about tangible item access? So a good example of this would be if you're in a store with your child or an individual and they see an item that they like and want, they're requesting it. Can I have that toy? Or I want that toy. And we're saying, no, we're not going to get that today. So then, challenging behavior follows, rather than saying, okay, just settle down. I'll give it to you. We are instead blocking access, making it clear how they can access the item appropriately. So that might be maybe not in the case of the toy, but maybe my daughter is saying, I want milk. Okay, well, you can ask nicely and I'll get it. Like, oh, okay, I want milk, please. Awesome. Thank you so much for asking nicely. That's wonderful. I really appreciate those manners. Timers can visually indicate to someone when something's available to access. Schedules are also good for that. Timeout can be used if needed, because again, it's blocking that function of access. If I request the iPad and I'm told no, and so I am hitting, kicking, yelling, crying, then timeout is not giving me access, so it's helping the function not to be met. And so it would be something that would be appropriate in that case. Okay, so what about dangerous or unsafe behavior? So I mentioned this a little bit before, but I think it bears repeating. We can still minimize our attention to those behaviors while maintaining safety. So for example, maybe we're talking about self-injury. So maybe somebody hits themselves in the head if they are frustrated or kind of their expectations are not met. So I can put my hand between their head and their hand while still not making eye contact or, kind of verbally, oh no, don't do that. Don't hurt yourself. I don't have to pay it a lot of verbal attention, but I can block it. And then I can provide selective attention, labeled praise, for more appropriate behavior. Oh, thank you for using your gentle hands. That's much safer. I love it when you are gentle with yourself and others. What we don't want to do is give these dangerous behaviors a lot of attention, because then they can start to be attention motivated, right? And we get in this cycle that can escalate. Okay, so let's talk about prevention. So these would be antecedent interventions that we put into place with the idea of reducing the chances of challenging behavior occurring. So sometimes I'll talk about stacking the deck in our favor. Typically, this takes some forethought, and sometimes it's not possible the first time that something occurs, but we can use those behavior logs to map out the situation and really decide on, oh, okay, this is what I was really missing previously. And I think if we add this, then it will probably reduce the likelihood of that happening. So keep in mind, general healthy habits are important for prevention as well. You know, adequate sleep, regular nutritious meals, appropriate medical care to rule out any medical explanations of behavior, and then participation in recommended interventions for other difficulties. So a lot of challenging behavior occurs because of communication difficulties. So it's very important in that case to be doing speech therapy while we're also intervening with behavior. Okay, so that would be this aspect of the data sheet, the antecedent, kind of what happens right before column. And so we would refer back to that when we're wanting to develop an intervention plan or a prevention plan. And that really relies on teaching and supporting a more appropriate behavior. So for kind of a sensory or internal need, that might involve scheduling preventative sensory breaks at appropriate intervals, using timers and visual schedules to make those expectations clear. We can teach and cue those appropriate ways to request and obtain sensory input. And we want to make sure, like I mentioned, that those appropriate methods are readily available and easily accessible. So maybe we have certain times where it is okay to use our Chewy tube, and maybe other times where we don't have access and we kind of redirect to just the activity that we're trying to engage in. Or maybe we are scheduling some of our self-stimulatory behavior so that it doesn't get in the way of our learning or participation in social activities. Okay, what about escape or avoidance behaviors? So timer and visual schedule are also really helpful for this. That lets the person know what to expect and when transitions are going to occur. So they have a little bit more of a heads up. It's a little bit easier to tolerate something unpreferred if we know that the preferred thing is going to happen a little bit later and exactly when it's going to happen. Those communicate expectations very clearly. It's going to be this and this and this and then this. The nice thing is once a routine is established, it's a lot easier to maintain. So changes in routine can be difficult, but once we kind of get on that pattern, we can pick up momentum. It's a little bit easier. Again, choices provide a sense of control and increased buy-in. Maybe with the bath time example, okay, it's okay to be frustrated that it's bath time, but thank you for coming into the bathroom. You know, which bath toys do you want to use? Do you want your Paw Patrol figurines, or do you want your kind of water fountain for the bathtub? Use behavioral momentum. So kind of start with those easier tasks, work up to the harder ones. Once you're kind of going in the right direction, kind of keep it moving. Don't pause and reflect. You can fall back on physical prompting or hand over hand if needed. And we can also adjust our expectations so that we are kind of, again, building momentum towards kind of expanding our expectations over time. So maybe I'm wanting teeth brushing to last for 2.5 minutes, ideally, eventually, but that's not where we are now. So maybe right now I am adjusting my expectations and we're just doing it for the time that it takes me to sing the happy birthday song. And then slowly I might build that up as we're able to tolerate it. Okay. So what about attention-seeking behavior or attention-motivated behavior? Catching somebody being good, kind of acknowledging their efforts and appropriate behavior is really helpful. If you think about it ourselves, if you get complimented by your spouse or a friend, or maybe your supervisor or boss on something that you're doing, and it makes you feel really good, and we want to keep doing that. Regular child-directed interaction, also called special time or one-on-one time, can be a really good preventative intervention. So that would look like a designated time where we are just providing positive attention using play therapy skills and toys that support that. So our play therapy skills would be kind of a bit of a different talk, but things like behavioral descriptions of what the person is doing. Again, those labeled praises that we've mentioned, imitating the person or the child with their play, being enthusiastic, reflecting back what they're saying, reflective listening. So those skills, and then toys that help us to really let our child lead the play. So usually the activities or toys that mesh best with that are creative toys that don't really have pre-established rules and don't require a lot of limit setting. So they're not dangerous, they're not messy or destructive. So for example, board games, while fun, great family activity, not as appropriate for CDI or special time because they do have pre-established rules. We want to let our child lead versus, no, you already rolled. Now it's my turn. No, you can't roll again. You already rolled. We want to avoid having to kind of criticize and give commands like that during special time. Same thing for toys that might promote aggressive behavior that we would then have to step in and set limits around. So no, boxing gloves, no kind of toy weapons, anything like that. In general, creative toys like dolls or figurines, play sets, houses, garages, farms, building or construction toys. So that might be magnet blocks or Legos, regular blocks, potato heads, things like that, where really you can play with it any which way. And that way you kind of just set them up, hey, it's time for special time. Here are our toys. What do you want to play with? And then we just follow their lead. Again, describing what they're doing, praising appropriate behavior in a specific way, reflecting back what they're saying, being enthusiastic and imitating. Let's see. We want to clearly communicate when we are available and when we're not, as well as what toys or activities are available. So use of visuals provides a really good reminder of expectations. So let's say maybe it's difficult for you to find the time to have an adult phone conversation because maybe your child or the individual you're working with really wants your attention when you're kind of giving it to whoever it is on the phone. So you can teach appropriate ways to get your attention. You can set up brief opportunities to practice that behavior and reinforce it outside of the situation you want to use it in. You can have visuals as reminders for what they should do. If they use a less appropriate behavior, you can use those visuals, maybe tap on them, direct their attention to remind them, kind of a prompt of this is how we do that. Maybe we're using a timer to kind of let them know how long until you're available again. Maybe it's a stop sign on you, or maybe a red tag, something that's kind of saying, no, not right now. This is when it's available. This is when I'm available again. And, you may want to do those training sessions with a small amount of time and work up to that. So maybe it's just, okay, we're starting with 30 seconds or a minute, and then I'm available. And maybe you work up from there to something that's realistic. I would also say helping them to engage in an appropriate kind of activity while you are unavailable is helpful. That way they're occupied. You don't have to worry about them potentially choosing something inappropriate to pass the time. Let's see. Yeah, so we talked about all of that. Okay, what about a tangible item, kind of desired object or activity? So examples of these might be like a candy bar or the iPad, or maybe it's going outside to the playground, or maybe it's kind of tickles or chase. So again, and you'll hear me say this, but visuals are extremely helpful about clarifying expectations. And so if we have a visual schedule that shows when, say, outside time is going to occur, when we're going to have our special time, we have a timer to kind of signal transitions between those. Maybe we have tickets or tokens for access. So maybe if we're talking about iPad time or TV time, maybe there's a token for each appropriate TV show. So maybe you have 4 tokens and your child turns in 1 and they get to access a show. And then when all our tokens are gone, our access, we no longer have access. But those are some visual, kind of tangible reminders of what's available and when it's not. Stop signs or X's are really good to also illustrate this. So maybe I have a stop sign on the front door showing that outside is not available, but maybe next to it, I have a visual that shows, playing with blocks, having a snack, or doing a puzzle. So it's kind of saying, no, not this, but these would be good. So helping again to kind of redirect without really needing somebody there. So it could be something that's independent once someone gets used to noticing those cues. We want to pay attention, really good attention, to the order of activities within somebody's day or schedule. Really, really common antecedent for challenging behavior is a transition from a preferred or highly preferred activity, such as electronics time, to something that is unpreferred, like maybe homework. That is a really tricky transition, and I would avoid that if you can, at all costs, really. And we can imagine that, you know, when you get home from work, if you're kind of sitting down, relaxing, and then you're trying to transition to, you know, doing the dishes or doing laundry, it takes a lot of motivation to do that. It's really frustrating and can be overwhelming, right? So this is kind of along those same lines. So making sure with the order of activities that if we have something that's unpreferred, it's being kind of buffered by a neutral activity before we do something. If we have a preferred activity, it's being buffered by a neutral activity before we move to an unpreferred or less preferred activity. Also, I think it's helpful to teach people to set up their own kind of naturally occurring rewards. So again, you know, helping them to understand, okay, if I do my homework for 10 minutes, then I can take a break and I might be able to kind of do that YouTube brain break that I've been wanting to do. So that's actually a really helpful strategy that could be used throughout somebody's lifetime. Let's see, again, once we establish a routine, things become easier. We start to know, oh, okay, you know, for example, maybe we are not doing TV or video games during the week, and that's become the routine, but we get access on the weekend. So it's no longer a big fight during the week because that's kind of been established. We just know we get access on the weekend. Again, preemptively engaging somebody in an alternate appropriate activity is also really helpful. So, you know, if I'm wanting the iPad, but if mom is kind of instead prompting me to engage with blocks and it is engaging with me, it's super fun, I'm less likely to kind of go back and be trying to get the iPad. No, it's not foolproof, but we're talking about kind of reducing likelihood, right, and increasing likelihood. One thing to think about is often if something's out of sight, it's out of mind. So if you can speculate ahead of time, okay, I could see this potentially becoming a problem or perhaps a fixation. If it gets spied, you know, maybe I'm going to make sure that that's kind of out of the way, right? So maybe we are going around the outside of the supermarket and we are avoiding going down that kind of toy art aisle of the supermarket so that we don't have to have a big fight over the kind of different toys that are there, the glitter paint that we may not want to have to fight over. Let's see, an exception. So, you know, again, if an individual has a really intense kind of obsessive or perseverative interest, out of sight may not be out of mind. And it may take a while to transition away from that, but, you know, something to think about. In that case, we can still redirect them to a different appropriate activity and engage with them, make it fun. Okay, so there are a few general things to avoid, and I've kind of hit on some already, but and some you could probably guess. Getting dysregulated ourselves is something that ideally we want to avoid. So if we are getting triggered and we're yelling or kind of getting upset, angry, we are just escalating the situation. It can be really hard to maintain calm. But I do think that that's a helpful reminder of what we are trying to get our kids or our consumers or clients to do. If it's hard for us, that's good to keep in mind. Nobody's perfect. And it's a really tricky thing, kind of a lifelong skill that we're wanting to teach of how to regulate ourselves and calm ourselves down. And, it can be tricky for anybody. Threats or coercion. I would avoid that because then it starts to kind of break down that trust. It hurts the relationship between the caregiver and the person. And if we don't follow through, it kind of reduces our credibility. So we want to mean what we say and to follow through on that so that the child or the person that we're working with understands, okay, I can take what they're saying at face value, and it is what it is. Corporal punishment, ideally we're avoiding that because it can be very confusing for someone to understand, okay, when I do it, it's discipline, but when you do it, it's aggression. It's a tricky line. And so, if we're talking about kind of modeling the behaviors that we want our child or our individual we're working with to emulate, ideally we're avoiding that so that it doesn't get confusing. But at least, if nothing else, avoid corporal punishment while angry, because that can really escalate things unintentionally. Timeouts and timers used inappropriately. So if I'm only using my timer, for example, as a signal when we're about to transition to something unpreferred, you'll start to see frustration, kind of negative reaction anytime that timer comes out. So we kind of start to pair it with, oh, now there's something that I don't like that's coming. So we really want to be mindful to use timers, for example, in kind of to show upcoming transition to something preferred, as well as unpreferred, and kind of how long a preferred and also an unpreferred activity is going to last. So making just sure to be balanced about that. And with timeout, we've talked about functions of behavior. So if the function is access to a tangible item or activity or attention, timeout would be appropriate. But if it's more sensory related or escape or avoidance motivated, not as much. We want to avoid any kind of negative interactions or negative consequences that occur kind of too far away from the actual behavior. So let's say maybe a child has a difficult morning getting ready, and so then they lose their iPad time that night. Some kids may be able to kind of maintain that connection and understand, okay, this is the consequence for something that happened this morning. But that time delay can be really tricky and can make that connection a little bit harder to see. So in general, kind of the younger the developmental age, the more immediate that consequence needs to be for the connection to be noticed. Let's see. We definitely want to not attend to inappropriate behavior that's not dangerously aggressive or destructive. So for example, whining, maybe cursing, attention-seeking behavior that, you know, if we acknowledge, really just kind of reinforces it. That can be tricky to do, particularly if we're out in public. I do think, though, that my goal is really to let people know, okay, this is what's coming into play. I know that, and I'm making an informed decision about responding this way. So you don't always have to respond in the way that kind of behavioral principles would dictate, but I do think it's helpful to know, okay, if I do this, this is probably what's going to happen. If I don't, this is probably the outcome, and making an informed choice. And then, like I mentioned, that tricky transition between a preferred activity to a non-preferred activity. So again, screen time to homework is a particularly tricky pitfall to avoid. Okay, so instead, let's try, and I tried to synthesize on these slides kind of information from everything within the talk that occurred previously. So if you're looking for some summary slides, these would be the ones that you would want to look at. So definitely it's very important as caregivers that we engage in self-care so that we can better support our child or the individual or individuals we're working with. We definitely want to think about when challenging behavior might be a reflection of a skill deficit, and work on identifying and teaching more appropriate skills. We want to have realistic expectations based on the individual's developmental level and their strengths and challenges. I will frequently kind of counsel people to, you know, if their goal is perhaps here, but really the person right now is kind of performing here, we can't, it's not advisable to jump from there all the way to here, but we can kind of increase our expectations over time and with success and end up there. But we're setting ourselves up for not for success if we're just trying to go kind of 0 to 100. Particularly when we're talking about individuals that where there may be other things coming into play. So for example, anxiety or attention deficits or kind of increased energy level or sensory issues. So those things we do need to be aware of and make kind of plan around, you know. Let's see. Ideally, we're anticipating problems or trying to anticipate them and pre-planning for how to avoid them. So for example, if I know that I'm going to be taking my daughter with some sensory challenges to an Auburn gymnastics meet. I don't know if anybody has ever been, but it is pretty sensory overwhelming. There's lots of lights, music. Anytime anybody does a good stick landing, there's a lot of cheering. And so that can be very overwhelming for anybody. But maybe I'm helping her to understand, okay, I've got your headphones here if you need them. And here's this appropriate activity. Here's your little doodle pad that you can use. If it's still too much, you can tell me I need a break, and this is where we can go. And maybe we kind of rehearse that before the start of the meet so that we have a plan. And we're more likely to be successful. Let's see. Definitely want to convey expectations clearly. I do think it's helpful to give a reminder of those right before you enter the situation. So it might be, okay, we're about to go to the pool. We're going to have friends there. It's going to be fun, but I need you to use your walking feet. If you forget, I'll remind you. But if you can use your walking feet, then maybe you can earn a special snack once it's time for eating. So kind of planning, communicating, making sure things are very explicit. Maybe you even have some visuals that then you can kind of prompt the person to refer to as reminders, which then helps them to be more independent and not to require necessarily that prompt from you. Let's see. Again, the regular kind of special time or child-directed interaction as a preventative intervention is really helpful. So not only does that strengthen the kind of caregiver individual relationship, but it's also an opportunity to really practice those kind of play therapy skills ourselves. And it's preventative for challenging behavior. So there's a lot of benefits to that. If you can do even at least 5 minutes a day is enough to see benefits, but it's not so much that it's overwhelming or impossible to do. When thinking about what to tackle or when to tackle things first, think about whether the status quo is sustainable over time or if we're going to need to intervene at some point. Let's see, for example, maybe right now we are not tackling nighttime staying dry overnight because we've putting our bandwidth towards maybe daytime toileting, but knowing, okay, that's not something that we can really or want to kind of sustain over time, but it's something that we can address later. I do think it's important not to try to change everything at once, but to prioritize so that, again, we can kind of build success and move forward from a position of success. Keep your goal in mind. So, for example, if my goal is to get my child to transition from outside playtime to bath, it's helpful for me not to be sidetracked by trying to address or teach different options for kind of whining or frustrated noises. If I know, okay, I'm just focusing right now on getting that transition to bath smoothed out and going well, and I can address the other later. I think that is very helpful. We can, if we're not keeping that in mind, then we can kind of get off track and start to try to, it almost feels like whack-a-mole, I think. So keeping in mind your goal when you're deciding how to respond. Okay. I do think it's important to note, we're all human. We're not going to respond in the moment during a stressful situation in the best way we can all the time. But all we can do is really keep in mind these behavioral principles and try to respond as best we can in the moment. And then maybe we debrief afterwards and kind of say, hey, let's map out those ABCs and the function and kind of see like, where can we tighten things up with the antecedents and the consequences? You know, what do we need to provide or implement or avoid in order to make sure that function is not met and things move more smoothly? So in general, we're wanting to provide immediate, or as close to immediate as possible, specific and clear reinforcement or praise for appropriate behavior. And then for challenging behavior, to minimize attention, kind of block further inappropriate behavior, prompt some level, may not be where you want to end up eventually, but some level of completion or engagement, even if it's hand over hand and you're doing the majority of the work. Still at that point, you get, you provide the reinforcement of the praise, and then kind of moving forward from a place of success, you know. So from maybe the child's perspective, like, oh, I didn't want to clean up, but that was actually pretty easy. And now we're having a really exciting, fun time. So yeah, okay, that's not that bad. We want to model the behavior that we want our kids or the individuals we work with to be engaging in. I do think it's helpful if we, as the caregiver, responds inappropriately, that we take a moment to kind of acknowledge and repair that. You know, hey, I'm sorry, I lost my temper, I raised my voice, I shouldn't have done that. That was not okay. You know, I'll try to keep using my inside voice because that's what we want. I think it says a lot. And I think it feels better for an individual to feel like, okay, this is not just stuff it's not just rules for me, but these are kind of things that we all have to abide by and follow. You probably remember from childhood or being a teenager, the frustrating feelings of like, well, why do I have to do this, but you don't have to do this? So if we can avoid that, kind of get everybody on the same page, things will go more smoothly. Again, we're wanting to triage difficulties, decide what to focus on first, and not try to focus on everything at once. Oops. And then just stay calm, you know, and give ourselves grace. There's going to be things that we can't anticipate or control, and nobody is perfect. So all we can do is try our best, monitor, and adjust. And I think that's what we're trying to teach our kids or the individuals we're working with. Okay, so I think I have about 13 more minutes. So I will go through this slide and then I'll move to questions. I have one more slide that if we have a chance, we'll go back to, but this is the top column. ABCs are kind of the challenging behavior situation. And then the bottom is kind of the intervention, preventative intervention that I put into place, and kind of the way that I'm adjusting the consequences to promote the more appropriate behavior. So for example, Shepherd has been playing outside at the water table for about 30 minutes. It's nearing bedtime. He's probably tired. It's been a long day. I interrupt and say, hey, it's time to stop and go inside and brush your teeth. Oh, I have a little bit more time, which is nice. So I will do that extra slide. So that's the antecedent, right? That's the lead up. And then we see the challenging behavior. You know, Shepherd's yelling, crying. He's trying to run off for about 15 minutes. So I'm chasing, you know, saying, hey, do you want a timeout? I need you to listen to me. You know, saying, okay, you know, hey, if you just come back here, you can have more time at the water table. kind of negotiating, saying, hey, once we do that, you can get iPad time if you come inside. So in effect, Shepherd is now accessing more water table time and a toy, and he's avoiding brushing teeth, and he's getting a lot of attention. So we've got a lot of functions there. Probably because a demand was placed initially, the initial function of the behavior might have been avoidance or escape, and that definitely comes into play in the consequence. However, also accessing more water time and a toy. So tangible item access comes into play, and a lot of attention was provided. So that is also a function that is coming into play. So maybe afterwards, this parent is sitting down and thinking, wow, that did not go quite the way that I wanted it to. Let me see if I can map this out and figure out, how can I change it to help things go more smoothly? I do think knowing kind of like, okay, this is what I'm looking for. I'm wanting a successful transition to going inside, kind of doing the activities that we need to before bed. So that's my goal. Okay, so thinking about, well, let's look at those order of activities. Water table is super highly preferred, and then I'm saying come in and do this behavior that you don't enjoy. So highly preferred to unpreferred is not a great immediate transition. So maybe I can add a neutral activity between this water play and brushing teeth. Maybe also instead of at the end of water play kind of saying, hey, time's up, I can use a visual timer during water play to help him to know when he's going to have to stop and move to the next thing. So he has a bit of a heads up. And maybe I do that during teeth brushing to kind of let him know how much longer he needs to do that. And I would say I haven't discussed this yet, but appropriate timer use would involve setting the timer, kind of helping that person to reference the timer. So if maybe the visual timer, maybe as is the case, my child would play with that all day long, and kind of interrupt my timing. So maybe I have this visual timer out of reach, but visible. And maybe periodically I'm saying, hey, Shepherd, this is about how much time you have left. When all the color goes away and the timer goes off, then it's time to go inside. Maybe I do that 5 or 6 times just to kind of give him a little bit more awareness of time passing. Now, you would also want to think about whether the individual you're working with is kind of more of a clock watcher and might be more distracted by the timer than helped. And in that case, you might turn it around unless you're referencing it. Visual schedule might be helpful to kind of show, hey, first we're going to do our water table, then we're going to do PJs. Next, we're going to brush our teeth, and then we're going to do cuddles and books. So it's kind of preferred, neutral, non-preferred, and then highly preferred. So something along those lines to help those order of activities be a little more conducive towards appropriate behavior. So maybe we put all that into place and he's making whining noises, frustrating noises, but I'm getting him to move into the house. We're not having to play chase and catch him and take him in. We're moving to PJs. Maybe I offer, do you want your Paw Patrol PJs or your Bluey PJs? And that's an exciting choice. Then we're moving to teeth brushing. If that's really unpreferred, maybe we listen to a fun song while we're doing it, or singing as we have the timer on. And then cuddles and books. So that progression might be done independently by the individual, or it might be us doing various levels of prompting, up to perhaps physical prompting or hand over hand. Again, I can always reduce my expectations if things are getting very challenging. So if typically I would want, at least 30 seconds of teeth brushing, but it's been a really tricky day, we've gotten this far, really just want to get over that hump and get to bed. Like, okay, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, yay, brush teeth, good job. Let's move on to the next thing on our schedule. And then specific praise for following directions, following the schedule, brushing teeth, etc. I think that you get more bang for your buck if you're praising following directions or listening, because that could be used for multiple different kind of directions or behavior, versus just thank you for brushing your teeth, which is specific to brushing your teeth. Honor the timer. So that's another really important piece. When the timer goes off, we're done. That transition is happening. It's not, oh, he's doing really well, like we'll keep going a little bit. No, we want that to kind of be binding, and a reflection of this kind of understanding and trust between us. Okay, this timer reflects the time, and when it's done, we're done. And then allow immediate access to whatever is following. So in this case, books and cuddles and positive attention. So, okay. These are 2 separate ABC sequences. So it's not one and then kind of this is how I would change it, but it's 2 different ones. So, this one, family is at the grocery store. Parents are getting items from their list and putting them in the cart. Maybe the child is sitting in the cart and unoccupied, which leaves hands free for lots of different things, and eyes free to observe what's around and get excited about it. So he sees an action figure that he wants and says, I want that. And parents are saying, no, we're just getting things on the list today. And that's very frustrating. And then we're getting some kind of unkind things said, some yelling, crying, flailing for several minutes. And so maybe in response, maybe mom's feeling guilty about some of the things that this child might have said, and so kind of providing comfort, providing some verbal attention by kind of refuting some of those statements. And then ultimately kind of saying, okay, it's just a small thing. Sure, it's fine. But, essentially a request was made and denied. Then we had our challenging behavior. And in response, we have kind of, attention. So very positive, like cuddles, verbal attention, and we get access to the action figure. So that's definitely a behavior that's going to be reinforced. So the next time these parents are out with their child and he sees an action figure, chances are this is where we'll go. Another example, and actually, in light of time, I won't go through kind of how I would adjust it, but we would put into place those principles that we've talked about. So maybe an alternate, more appropriate activity to occupy them. Maybe we're repeating as we go into the store. Okay, we're not getting anything that's not on our list, but if you can stay with the buggy, use your inside voice and kind words, then you can earn this special snack at the end. Okay, so this ABC sequence, a child is sitting by themselves, watching TV, otherwise unoccupied. So maybe she's chewing on her sleeve while she's watching and sitting for about 10 minutes. And maybe dad walks by and says like, oh, hey, Lottie, quit chewing on your clothes. Your mom's going to be really upset if you make a hole in them and she has to replace it. And so maybe Lottie is very compliant. Maybe she stops in that moment, but it's a behavior that garnered attention, right? So it probably initially started for a sensory function. She was alone while she was doing it, but now we've brought in an attention component. So, perhaps later, maybe mom and dad are involved with younger sibling and, Lottie is wanting some attention. And so, okay, I'm going to do that. That always gets a big reaction, right? So better if we kind of have our chewy necklace right there. We go over, we don't even have to say anything. We kind of block, move the sleeve down, put the chewy necklace in her hand and bring it to her mouth. She's putting it in her mouth. Oh, thank you so much for using your chewy necklace. That is awesome because it's meant to go in your mouth. So getting a lot of good attention for that. And maybe we're checking in on her and catching her being good as she's using that over time. So she's getting even more reinforcement for that behavior. Okay, so I'm going to stop now for questions. And I think those will be given to me from what I understand.
Yes, I have those questions for you.
Perfect.
Okay, the first one I have is, what if I cannot determine the antecedent of a behavior?
Okay, that is a really good question. Sometimes we can't. Sometimes we're not there, or sometimes our back is turned. And in that case, we can try to make our best guess. So if maybe if you're in the other room, for example, and your two kids are playing together and all of a sudden one makes a really kind of distressed noise, we can go in there and maybe we don't know what occurred. But, we're seeing maybe older sibling kind of clutching a toy and younger sibling being distressed. So we might be able to make some assumptions or some guesses of like, oh, okay, maybe there was kind of an argument over who had the toy. But in that case, we can still do our best to minimize attention for the inappropriate behavior and promote the more appropriate. So maybe it's taking and asking the child who might be able to give the best account of what happens. Maybe it's just, oh, it looks like brother was using this toy. Okay, brother, you play with it. I'll set my timer. When the timer goes off, then sister can have a turn. So we're still kind of promoting appropriate turn taking and usage of the toys. We're marking that using the timer. And sometimes we just respond the best we can. So for example, there may be kind of an internal antecedent that we can't see. Maybe a child is feeling sick. Maybe they have an anxious thought that they're then responding to. We can inquire about those when we're able, but sometimes we're just responding as best we can to the behavior in the moment. You can also map out what you do know on those ABC data sheets or behavior logs. And if you're working with any interventionists, you could perhaps consult them and say kind of, I'm just not sure what happened here, or if I'm missing anything. What do you think? And they can give you probably some good suggestions.
Okay. Another question I have, they had was, how do you reinforce visuals while driving in the car?
Oh, that is a good question. Maybe, for example, I have maybe my child historically, to get my attention, would yell stuff in the car, or maybe she would kind of throw stuff at me to get my attention. And obviously that's dangerous. That's, not something that we want to continue. So maybe I decide, okay, I'm going to make a visual that shows maybe a, maybe it's if the child can read, a little thought bubble, or a speaking bubble that's, mommy, I need help. And so if my child is then kind of yelling, screaming, I'm still driving, but maybe I've put that on the back of the passenger seat, which is right in front of my child. So maybe then I just tap on it without making eye contact, without saying anything, kind of as a reminder for, hey, this is what I'm expecting. This is the appropriate behavior that's going to get you that response. So that would be my best suggestion, is kind of setting it up to where you could direct their attention with kind of minimal unsafe behavior on your part.
Okay. Another one was, how can I identify my child's triggers?
Yes. So if you are taking that ABC data, those behavior logs, you will start to see some patterns. And if you're having trouble kind of working with your interventionist, but you may notice, like, wow, 75% of this is transitioning from a really preferred activity to a non-preferred one. And that's a good indication, right? And then just kind of living your life, you may notice some things like, wow, my child has some real sensory sensitivities. And so when there's a lot of noise and a lot of people, that's a big trigger. So kind of just collecting data as you go along. And interventionists who also work with your child may be able to inform you of triggers they've noticed. Same for like school staff. Or if we're talking about kind of an older individual, maybe in supportive living kind of staff that are working with them. And we're all putting our heads together to kind of say, okay, these are the things that we've noticed, oh, okay, these are what you've noticed too. All right, so now we have a better understanding and more comprehensive idea of some of the things that trigger these challenging behaviors.
Another one I have is, starting a new routine seems really overwhelming. What is the best way to start a new routine?
Yes, starting a new routine can be really overwhelming. So I find a few things help. Number one is talking about it ahead of time. So in general, if you are wanting to kind of teach a new skill or change something, if you rehearse it, kind of discuss it outside of the time where you're actually wanting them to implement it, that is most helpful. So maybe our plan is next week to start a new routine. And so maybe, last bit of this week, over the weekend, we're kind of talking about, hey, on Monday, remember, we are not using pull-ups anymore. We will just be using underwear. And so maybe even there's a visual that's kind of showing a countdown to underwear. And we're talking about it. We're helping that person to understand, okay, you know, if you need to go to the bathroom, this is what the plan is. You know, if you have an accident, this is what the plan is. So we're kind of discussing the routine, we're implementing or at least developing the supports, kind of helping that person to be more familiar with them ahead of time. Maybe we're role playing it. Maybe we're breaking that new routine down into parts. So maybe instead of changing up our whole routine for the day, maybe we're just initially changing kind of something in part of our morning routine. And then once we've got that going smoothly, then maybe we're changing something in our afternoon or evening routine. So it could be something where we're just making some small changes over time versus changing the whole thing. You know, most people, I think, have kind of an idea for like, oh no, better to rip off the Band-Aid with my child and just change everything. We know it's going to be rough, but we're just sticking to it. You know, we're helping everybody to be more okay with it by scheduling in some, you know, positive preferred activities that are calming. But we know from past experience that works the best for us. Wonderful. You know, maybe somebody else, it's the opposite, where it's, no, we do best like slow and steady. And that's perfectly fine too.
Okay, I think we have one last question.
Sure.
I think you answered it earlier, but the question was, what do you suggest for nonverbal and not always knowing what's going on with your child?
Yeah. Oh, and that is a tricky one. I think we're more reliant on that in those situations on either observing something happening or getting perhaps corroborating reports from others who are around. Maybe we've worked with our child on alternate ways to communicate. So maybe a communication board or an AAC device. So maybe they're able to communicate with us that way. You know, maybe it's something where we're kind of pulled into it in the middle by some distressed calls, and we're just trying to manage the situation as best we can, and then to kind of, again, map it out, kind of think about it that way. You know, one example would be maybe some of the sensory or internal need motivated behavior. So maybe a child who's nonverbal might seek out a lot of oral input, might be mouthing or chewing some things that are not appropriate. So as long as we know that, we're making sure, okay, we're going to kind of remove or block access to any of this stuff so that it's not available. We maybe notice some patterns like, oh, he's doing it more often when he's kind of sitting and not really occupied with anything else. So since I know that's a triggering situation, if I know we're going to be sitting for long periods of time, maybe I'm going to engage with him to make sure that they were occupied appropriately. Maybe I'm making sure that that kind of chewy tube or necklace is available. And maybe we're scheduling in some of the appropriate chewing on the things that are meant to be chewed, so that we are kind of making sure that we get that input, so we're not seeking out additional kind of less appropriate input. So it a little bit depends on the behavior itself and kind of the function, but we can also do the same thing in terms of, okay, you know, how has this gone in the past? Let's map it out. What could I do to kind of solve any barriers that pop up or any kind of sticky wickets? What can I do? And let me make sure that I'm kind of scheduling time for this appropriate behavior and helping them to engage with it, particularly in situations where I know that the challenging behavior is more likely to occur.
Okay. Thank you. All your information today was very helpful. I hope everyone gained some great information from today. And
I hope so too.
I, I think I gained some very helpful information. So I hope everyone did too. We'll be back on in the next 15 minutes, starting with our next speaker. And we would just like to thank you, Dr. Barwin, for taking out your time to be with us today.
Of course, thank y'all, especially for bearing with me when my slides weren't showing initially. I appreciate the feedback.
Well, just bear with us with our technical difficulties today. So we
Well,
thank you, and you can
yes.
stay on to enjoy the rest of the conference.
All right, thank y'all so much.
Thank you. We'll be back in 15 minutes.
Hello, everybody. We are back. I hope you enjoyed our first speaker, Dr. Sarah Bowman. She was wonderful, and we are grateful for her time. I am here to introduce our next speaker. This is Dr. Stephen Shore. Dr. Shore is an autistic professor of special education at Adelphi University. He has written books that include College for Students with Disabilities, Understanding Autism for Dummies, Ask and Tell, and Beyond the Wall. Currently, he serves on the board of Autism Speaks and is one of the first 2 autistic board members in its history. And they're looking to improve the potential of those on the autism spectrum. He once headed the Asperger's Association of New England and was on the board of the Autism Society of America. Diagnosed with atypical development and strong autistic tendencies, and too sick for outpatient treatment, Dr. Shore was recommended for institutionalization. Nonverbal until the age of 4, and with much support from his parents, teachers, wife, and others, Stephen is now a professor at Adelphi University, where his research focuses on matching best practices to the needs of people with autism. So I am pleased to introduce Dr. Stephen Shore.
All right, so it's a pleasure being in front of all of you to talk about a very important part of life, and that being relationships and sexuality for autistic individuals. So let's begin with looking at a few things to get out of the way. And that is, as we talk about sex and myths of sexualities that Peter Gerhardt and others bring up, it's important to keep in mind that autistic and otherwise neurodiverse people, these are common myths that people have about us. We're not interested in it, we're hypersexual, or solely heterosexual. However, what we find is that autistic and neurodivergent individuals are just as sexually diverse as everybody else. So whatever we find in the general population, heterosexuality, homosexuality, various expressions of gender, we find that in the autistic community as well. However, we're challenged by differences in language, communication, and social interaction. And additionally, while we may be interested in these areas, we're lacking a primary source of information. Where do most people learn about dating, learn about relationships? Often that's in middle and high school, that's where it begins. However, for autistic people, we tend to have less contact. So we have to get our sources. We have to get our information from other sources. And by keeping that in mind, we find that autistic individuals, we can have successful relationships. And often that's with a person who has a difference. And that difference might be neurocognitive, it might be cultural, it might be age, it might be some other difference. And I'm going to, a little later, I'll get into why that difference may be important. So the question is, how do we promote success for autistic and neurodivergent people in this important part of life? So a little bit about me, what brings me here to talk to you about autism, relationships, and sexuality. We take it from the beginning. Where at 24 hours of age, my wife says I looked like an egg. And then at 24, I should say at 18 months, like about 30% of us on the autism spectrum, I was struck with the regressive autism bug, where I lost functional communication. I had meltdowns. I withdrew from the environment. And in brief, I became a very autistic little kid. There was so little known about autism, so little known that it took my parents a whole year to find a place for diagnosis. And when they did, the doctor said, oh, the child is too sick. You should send him off to an institution. Well, fortunately, my parents, like we see ever increasing numbers of parents today, they advocated on my behalf and they convinced the school to take me in about a year. And it was during that year my parents implemented what we would today refer to as an intensive home-based early intervention program. And that program emphasized music, movement, sensory integration, narration, and imitation. And that's just today's terminology, because in those days, the concept of early intervention didn't even exist. So what did my parents do? Well, first they tried to get me to imitate them. And that didn't work, perhaps due to a difference in mirror neurons. So then they flipped it around, they imitated me, and I became aware of them in my environment. And then they were able to move me along. So then the question is, what does getting a toddler to imitate, or I should say, imitating a toddler have to do with relationships and sexuality much later on? And I believe the commonality is that my parents were successful because first they established a connection. And that is what we're often challenged with as autistic people in developing relationships with others. Make that connection, find something in common. In that case, I was flapping or making various sounds, echolalia, and that's how my parents made the connection. Later on, as an adult, it's important for autistic people when making connections, that we find other people who have similar interests or the same interests as us. That's where we best make connections. And in doing so, we increase the probability of meeting other people and developing relationships, and later on into intimate relationships. So with the work that I did, speech began to return at age 4, and I entered the school that initially rejected me. I believe that we have the technology, we have the know-how, we have the wherewithal, so that instead of looking at the closed doors of disability, disorder, and deficit, when we think of autism, we can look at the abilities of autistic people by asking, what can the autistic person do? And rather than autism being a bomb, you might say autism becomes da bomb. And that happens when we focus on the abilities and ask the question, what can the autistic person do? And work from there. So here I am at age 4. I entered that special school. I got reevaluated. Instead of being considered a psychotic and ready for an institution, I got upgraded to neurotic. So things are moving up in the world. I was found by my parents at age 4, taking apart a watch with a sharp knife. I'd pop open the back, extract the motor, remove some of the gears, spin them around, and then put it all back together again. The watch still worked, and there weren't any pieces left over. So amazing fine motor control to take apart a watch. But then there's always that curious question, where did that motor control go when it came to penmanship? I was a penmanship disaster, just like so many of us on the autism spectrum are. And I think this is an important illustration of the often sharp lines of demarcation between the abilities autism brings us and also some of the real challenges that come with being autistic. So moving on to age 4, after, or I should say, on to age 6. In kindergarten, regular school kindergarten, I was a social and academic catastrophe. You know what happens to people who are different in grade school. I suppose repeating the letter B over and over again didn't endear me to my classmates. And fortunately, we now have more strategies in which to help both autistic and non-autistic people understand each other and to get along. Academically, I was about a grade behind in most of my subjects. And I would spend my time sitting in the back of the room, reading books on my favorite subjects, such as astronomy, aviation, electricity, dinosaurs, music, volcanoes, whatever it might be. And then after I was done with them, putting them away and getting books on another thing I was interested in. And in those days, teachers just kind of left me alone in the back of the room, and they called that inclusion. However, given what little they knew about autism in those days, kind of letting me do my own thing was probably for better rather than for worse. So now we get into relationships. What about developing those relationships? Relationships begin with friendships. That's the foundation. And I find what can be helpful is to consider the visual of circle of relationships. And we can categorize people in these various circles, and there's certain things that you do in certain ways you interact with people depending upon the circle. So let us suppose we have a young autistic child, age 4, and they hug everybody they see. So at 4 years of age, that can be very cute. And it goes against the myth that autistic people don't like to be touched. Many of us seek deep pressure, and that's all well and good. However, then the question is, what about when we get to age 14 or 24? Can we satisfy our need for deep pressure by getting a hug from everybody we see? And so in that way, perhaps by categorizing relationships in terms of, well, who can you get a hug from? You can get one from your immediate family or boyfriend or a girlfriend, just about whenever you want. What about a close friend? What might be the difference? Would you hug an acquaintance? Is there any time that you would hug a stranger at all? And in that way, it can be a good way to help a person categorize what is best ways to interact with people in these various categories. I've also seen 5-point scales used in a similar way. So whatever works, maybe developing a power card, for example. So as we move along, and often we see from media, for example, people getting to the sexual part of things really quickly. In a half-hour show, you can have one person meets the other, they're interested in each other, they date, and next thing you know, they have a family and a baby, and you get all that done in half an hour. It takes longer than that. So what are some good skills that are needed for developing friends? And certainly listening is a very important skill. Being able to listen to the other person, active listening strategies that can be taught and practiced, modeled. Hygiene is another one. And given sensory issues, that can sometimes be a challenge. So for example, I know some autistic people who refuse to take showers because taking a shower is like standing under a hail of bullets. So we'll need to find another way to address hygiene for that person, including soap. Some autistic people have difficulty tolerating scented products. Others need very highly scented products to feel that get a sense that they're really washing up. Another subtlety regarding soap is that most soap leaves a sort of film on a person's skin. And I have what I call a scrub ratio. And that meaning how much time do you put into scrubbing the film off after you've washed yourself. And there are some soaps where there's a 10-to-1 ratio. You might spend 5 minutes or a couple minutes washing yourself off, and then you have to spend 5 times that scrubbing off the film. And that's that would make me not want to bother to wash. But fortunately, there's other soaps that have very low scrub ratios and they just rinse off. So it might be something as subtle as that most people wouldn't perceive, but would be extremely perceptible to the autistic person. Talking with each other and sharing about life experiences. And agreeing to disagree is another one. Disagreements aren't necessarily a blood sport. As we think about boy and girlfriends, the most important word is being a friend to the other person, showing interest in the other person, giving them a chance to talk. For example, getting overexcited about potential sex with another person can often get in the way of developing that friendship and romance. Another area that is important to cover is touching. When do you touch a person? And it's best to ask, is it okay? Can I hold your hand, for example? I have a friend, relatedly speaking of holding hands, she desperately wants to date, but she has such tactile defensiveness and sensitivity in her hands that she just can't hold another person's hand. And so that's something that needs to be addressed, worked around, and it is going to involve a certain amount of disclosure at some point when she's in the dating process. It's also important that the autistic person has a trusted adult if they feel uncomfortable about their actions, their own or somebody else's. And then finally, this is where autistic language is better than non-autistic language. And I know so many people have gotten into trouble when they've mistakenly interpreted a person indicating they want to stop or just saying no, they don't want to do this as a sort of yes. And that causes all kinds of problems. No means no, stop means stop. Just take the words for what they are. So as we consider topics to cover and engaging in behavior, it's important to keep in mind in describing what is public versus private behavior. And this can involve sexuality, touching another person, and also masturbation, which is an important subject to cover as well, something that everybody does, including autistic people. However, as I mentioned a little bit earlier, us autistic people don't have a source of information that most other people have. So this may be something that needs to be taught. Good touch versus bad touch. And the reason why I have this here is because sometimes people talk about good touch and bad touch. And I think it might be better to classify appropriate versus inappropriate touch. Where do you touch other people? Where do you not touch other people? What happens when you go to the doctor and they touch certain parts of your body? Probably they're supposed to do that, and that's appropriate. However, as we look on the right side, it's important for that autistic person to have someone, a trusted adult. Well, gee, when the doctor touched me here in my private parts, that made me uncomfortable because nobody is supposed to touch that except me. And that might be a time to explain that the doctor is doing some sort of examination and may need to do that. Learning the body parts, both the proper names and also the slang names for various body parts. Keeping in mind boundaries. Boundaries, when talking about boundaries with autistic people, sometimes what I'll do is I'll put them on a YouTube chase. And what I mean by that is that we may talk about personal space bubbles, for example. Now, how close do you stand to another person, whether they're a stranger or a friend, and so on. And then after talking about it, perhaps modeling it, practicing it. And now go home, and when you come back in a couple of weeks, see if you can find me 3 examples on YouTube where personal boundaries are being not being are being violated or being crossed. And also some more examples of where they're being respected. Masturbation, we talked a little bit about that. We're going to get more into that. Where is it appropriate? When is it appropriate to engage in masturbation? And also getting along with others, such as in the area of social skills, building relationships. Danger and abuse prevention, that's an important area. People with disabilities have a higher incidence of abuse, and those who are autistic have an even higher rate of abuse. So strategies in avoiding these situations. And then skills in dating, and what responsibilities do you have and values? And that is that with a lot of responsibility that goes along with dating and engaging in sexual interaction. So here I am at age 8. I spent hours cracking open small rocks with a big rock. I was fascinated by the shiny specks inside and the sharp edges. That grew into a highly focused interest in geology and geography, many others, such as astronomy. I remember at about this time, a teacher came to my desk while I had a stack of astronomy books on my desk and said that I'd never learned how to do math. But somehow I figured out just enough math to teach statistics at the university level. We all learn better about what we're interested in. If we're interested in something, we're probably good at it too. And for autistic people, it's even to a greater extent. And I bring this up because also about this time, I started getting interested in bicycles. And I got it to a point where I could take a bicycle apart down to the ball bearings and get that back together again. And whatever the interest is, that can be an entryway to developing interactions with others. Riding a bicycle is a common thing many people like to do. What about finding a bicycle club? And later on, especially when I got to middle and high school, I did join bicycle clubs. And it was a great way to meet people. And I wasn't interested in dating at that time, so it wasn't an avenue for that, but I can see how it could have been an avenue for meeting people and perhaps moving on to developing an intimate relationship. And that leads us to special interests. Now, this is the deficit model way. This is a deficit definition of highly focused interests. And many of you may know autistic people who get so fascinated with one topic or one thing or other, so that it interferes with other aspects of life, maybe almost every aspect of life. And it's seen as a negative, something that maybe has to be taken away, or maybe something that has to be earned. However, what if we were to rephrase the definition as an interest of such great intensity that it provides powerful motivation for exploring learning different curriculum in school, if we're in education, or perhaps exploring other organizations that are also engaged in that particular interest, whatever it might be, whether it's bicycles in my case. It was also music. I also got fascinated with music, and I got involved in a number of musical ensembles, and therein was also another area that provided possibilities for developing friendships and relationships with others. So here are some of my interests. They come and they go. Sometimes there's more than one of them at a time. And I want to make sure that you learn them all because there's going to be a quiz afterwards. Age 10, I was awfully concerned about the letter E, because I heard you have to drop E before adding ing, and wasn't that E going to get hurt when it fell to the ground? I had a friend who said he felt like a pizza, he didn't look like one, he didn't smell like one. So there were some issues there. And what we're talking about is literal thought. We tend to think literally. And in terms of developing relationships and dating, there is so much, you might say, non-literal thought. And so much, this is what this leads into, is hidden curriculum when it comes to interactions with other people. Whenever you're with another person, even if there's only one, there's probably going to be some set of assumed knowledge that's not directly taught. And the two things that I can think of that have the most amount of hidden curriculum is dating, and which is why probably many people can get in trouble with misinterpreting a no or a stop as a go on or a yes. And also interviewing for jobs and keeping a job. There's so much in the area, in terms of unspoken rules. The people, it's just assumed that other people know. So it's this hidden curriculum that often needs direct instruction. So an example, it's middle school, our class gets interrupted. And by an announcement, the principal had lost his mother. So that made me think about what my parents would tell me when I'd lose something. Oh, it's in the last place you left it. Which I always thought was kind of a silly answer, because if I knew where I left it, I wouldn't be asking them. But anyways, so that's what came to mind when I heard about the principal losing his mother. And maybe if and I like the principal, so I thought maybe I could help him by suggesting if he tried to remember where he last saw his mother, he might find her. Well, what does that mean? It means his mother passed away. Well, that's yet another idiom. You have to drill through two idioms to get to his mother died. And if somebody had told me that directly, then I would have been much more appropriate to the principal and the situation. And it was a lack of understanding idioms and unspoken rules. For some of us, if you ask us to hold the door, that's the impression we can get. Telling one of us, you'll get to your question in a minute. Well, guess who's counting the seconds? We tend to think in black and white. So when we call, and I remember this in high school, calling someone on the encouragement of my parents, someone who might be good, I thought might be good to date. And she said, I called her on the phone. She said, no, she wasn't interested, maybe later. And what does that actually mean? The autistic person will catch on to the maybe later, and they're going to call back and may keep doing that until they're absolutely told no. And if they keep on calling or contacting the person that they perhaps want to date, then there may be a problem with stalking. So direct communication can be very, very helpful. So speaking of communication, let's take a look at learning these rules. How can we learn these rules? It's easy to learn these rules, and the challenge is integrating them. And I know many autistic people who will memorize an entire Emily Post book of manners or something similar and can quote it chapter and verse, but actually using it in this information in real time can be a challenge. So part of what might help is learning these rules of these unspoken rules of social interaction, just as we're going to see in this video clip of Adam. And the question here is, where Adam is at a party, and perhaps he didn't understand some unspoken rules. I'm going to play this video, and I'll also be looking at the webinar chat for someone to tell me if the audio, to let me know if the audio is coming through. So let's check that out. Question is, what protocols did Adam miss when asked to meet the baby?
You've got to meet the baby. Her name is Lin Yao, which means beautiful jade treasure. That's beautiful, don't you think? I mean, really, she is young enough. We could call her anything. Her name is Lin Yao. That's what I said.
And that's who she was when we got her.
She's
I know, look at her.
yeah, she is. We have a video, of course. Would you like to see the video?
No, thank you. Where's the bathroom?
Down the hall, second right.
I'd love to see the video.
All right, so I didn't get any message regarding the audio, so I'm guessing the audio did go through. And as we look at this video, what is the proper protocol when somebody asks you if you want to see pictures of or actually meet a baby, and it's expected that, oh, I just got the message, the audio worked. That's great. It's expected that you do want to see the baby, and you make there's certain comments that people make when you see a baby and talk about how cute the baby is and they coo or whatever it might be, things that people don't even think about. You just do it. And if Adam really had to go to the bathroom, that moment he's about to explode, then the way to address that might be, well, I've just got to go to the restroom, but I'll be right back, and I look forward to meeting the baby. So it's rules like this that may seem simple to most people, but for autistic people, direct instruction may be required. All right, let's take a look at another one. And this is something that can be challenging for many of us on the spectrum, and it regards special interests and perhaps getting a little bit carried away. So let's take a look at what happens in this clip.
Either you believe that human beings share some basic similarities, or you just throw the towel in.
Buying a telescope is a complicated decision. You should focus on your interests.
No pun intended.
What?
Focus.
Right. Are you interested in the solar system, moon, planets, etc., or deeper space, nebulae, star clusters, galaxies? Then you want a much larger lens with a Dobsonian mount. The APO refractors go up to 180 millimeters. Hi, Michael's looking for a telescope to buy for her cottage in Kerhonkson. For deep space in a static position, you could really think about some bigger reflectors. Have you heard too much about telescopes?
No, just some of what you're saying is going right over my head.
Oh, okay. Well, I'll start over. 3 basic considerations. Kind of lens.
Go to Robin and Jen with me.
All right.
Thank you for the information.
You're welcome. It's a very big decision.
Nice to meet you, Michael.
And you.
So I guess she'll really need that drink afterwards. And so that's something that we may need to learn as well when we're interacting with others. Conversational protocols, I talk a little bit, you talk a little bit. I remember working with a middle-aged adult, and my goal was to help him understand conversational protocols, that related to talking about special interests. And he'd monologue about various interests. So I gave him some strategies and was telling him that, well, one thing to look for is whether someone's looking at their watch more than once, repeatedly, when you're talking to them, because that is a nonverbal signal that the person is getting bored or they want to leave. And you'll want to give them a chance to talk. So he said he understood that. And about 10 minutes later, he's on another special interest role. And I say to him, I'm looking at my watch. What does this mean? And he thought for a moment, and it's like the light bulb went off over his head. He said, well, some watches have Roman numerals, others have Arabic numerals, and there's a clock on the wall if you want to see what time it is. So he didn't get it. Well, then I saw him the following week, and I noticed that the following week that his conversational jags, you might say, were shorter, and he gave me chances to talk. And so what does that mean? It took him longer. It took him time to process this information, longer than when I was with him. He had to think about it over the week, but he eventually did get it. And then at the end of that session, he had a lot of questions as to whether everything he did was appropriate and whether he didn't say anything wrong. So that was another kind of perseveration, but at least he got the idea, and that was good. So it requires things such as conversational protocols often require direct instruction, practice, and also keeping in mind that many of us autistic people will need additional time in which to process information.
Either you believe that
Oh, there we go. Oh, here I am at age 13, and that's middle school, middle and high school. You don't need to be autistic to have challenges in middle and high school. But for me, it was actually easier. And one reason is that I finally figured out that using words instead of sound effects from the environment really helped with social interaction. I also learned, or I should say, I also was able to engage in my highly focused interest of music. I joined the band. So now I've got the structured activity, and that's something that we need as well, with like-minded people. And now there was something in common to talk about. And of course, being autistic, I had to take it to the nth degree, and I got so fascinated with music and musical instruments that I decided that I needed to learn how to play all the instruments, every last one. So I'd spend hours in the instrument closet, taking apart instruments, sometimes combining 2 or 3 instruments into contraptions that never should have seen the light of day. I didn't learn them all, but I did get it up to about 15. So at that point, another avenue for potentially meeting other people, and eventually leading to university, where I became a music major and studied music all the way through my doctoral coursework. And then after finishing that coursework, I started getting more interested in autism and special education. So I defected to the School of Special Education and did my work. Did my work. Or I should say, got my doctorate in special education, and now here I am in front of you, and also teaching as a professor at Adelphi University. So music can be very helpful for developing interactions. It's part of the reason that I give music lessons to autistic children, is because in addition to being a real life skill in which to develop interactions with others, it also there's a lot of extra musical benefits. And also, I just haven't figured out how to teach typical kids yet, so I just stick with the ones on the autism spectrum. They make a lot more sense. So, another video of unspoken rules of relationships. What direct instruction was Adam given? And I just peeked over at the webinar chat. Somebody asked if I have any resources for helping teenagers navigate the social relational cues that need to be learned during the teenage years. And yes, I do. Those are coming up a little bit later in the presentation. And they're in the presentation, which means that you'll have all you need in the handouts in which to locate their resources. You can also go on to Amazon.com and type in that very same thing. Relationships for autistic individuals, for example, will get you many, many books, many resources in which to gain further information. All right, so back to the video. What direct instruction was Adam given in order to provide for what his girlfriend needed?
Maybe I should go.
I'm sorry. I'm just
Sorry, you're.
a little upset. My father's an accountant and he's been accused of doing something illegal.
Oh, did he do it?
No, but tonight he said it looks like he will probably have to go on trial. And I know your father just passed away, so I shouldn't even.
I can see that you're upset, but I don't know what to do.
Give me a hug.
Yes.
Adam, I'd like you to give me a hug.
So it took her 2 steps, you might say. Adam, can you give me a hug? And he certainly could do that, but didn't realize that the question was really meant, I would like a hug. So until she asked for that directly, that's when he understood that that's what needed to happen. So direct communication, again, is very important. So here I am as an adult, or at least in college. College was utopia. I had more friends. If I wanted to ride my bicycle at midnight, I could find someone just as strange as I was to also ride at midnight. No more bullies. Interesting courses. I remember my first encounter with dating, and I'll call it an encounter because I'm not sure if it was really dating, is after spending a lot of time with this woman in undergraduate school, she suddenly told me that she likes hugs and back rubs. And I'm sure that has a particular meaning based on what I know about dating these days. But what I thought was, gee, I've got this brand new friend who also doubles as a source for deep pressure, like a Temple Grandin squeeze machine. So I'm always happy to receive hugs and deep pressure. What did she really mean? Well, we do a number of things together. I even slept over at her house, and that's really exactly what we did, just slept. I think she had some other things in mind. And after a period of time, she did seem rather frustrated. And finally, I learned after a lot of conversation that she wanted to be my girlfriend. But I wasn't interested in dating at that time. And I certainly didn't pick up on any of the clues. And there goes that hidden curriculum of dating, a lot of unspoken rules. And I just didn't receive them. Well, then we fast forward to graduate school, and now I'm spending a lot of time with this lady, initially reviewing each other's homeworks. And then we move on to doing things socially. And then one day at a beach very much like this. She gave me a hug, a kiss, and held my hand. Now I had the social story down, and it went something like this. If a woman hugs you, kisses you, and holds your hand all at about the same time, it probably means they want to be a girlfriend. And if that's the case, you better have an answer right away. And that answer could either be yes, it could be no, or it could be further investigation and analysis is indicated. Well, it seemed to be a good thing to do. And well, now we've been married for, now we're getting on 34 years. And if you want to learn more about what life is like on her side of the spectrum, I encourage you to read her contributions to my autobiography, Beyond the Wall. And now I spend most of my time in a sheltered workshop for people with Asperger's syndrome, although now it's referred to as autism at level 1, where we spend months, years, and lifetimes perseverating on subjects that maybe other people don't want to listen to, but we talk about them anyways. Sometimes social interaction between community members could be improved. Some people refer to this place as a university. If you want to find undiagnosed people on the spectrum, then I encourage you to check out your professors. So what are some strategies that can be used to help people better understand social interaction? Well, sometimes comic strips can help. And this is one of the many social narratives that are out there. And this is a little bit what I experienced, or it relates to what I experienced. And had this strategy existed, had I been able to use a strategy like this, or somebody to support me in a strategy like this, then I would have understood that the person who I was spending time with really wanted an intimate relationship. And once I know that, then I can make a decision. Do I want to have an intimate relationship with this other person, or do I not? So comic strips can be very helpful in addressing what is being said as compared to what is being thought. I'm just trying to get this to move to the next slide. Here we go. So that question, back to Melanie's question, do you have any resources? And there are plenty of resources in there. One of them is, I think of it as an owner's manual for living with an autistic spouse. And actually, I just think of it as good, just good advice for relationships. And this book by Maxine Aston, which I believe now is in its 2nd edition, is chock full of strategies and things that a couple can engage in order to achieve better communication. So, for example, is it always important that there's direct eye contact when talking? What about sitting side by side and talking, or sitting in a dark room and you don't need to look at the other person? Or in some cases, perhaps communicating through instant message, even though the two people might be sitting side by side or even one room away from the other. The Autism Couples Workbook, 2nd edition, same person, Maxine Aston. There's some good strategies in there that can be generalized to people, for autistic individuals. Perhaps if both for the person, if both of a couple are autistic, or perhaps if one of the person in the relationship is autistic. So as we move along, I've got an appendix here, which I want to show you a little bit more information that can be helpful, some more helpful information. An interesting social narrative that was developed by Boston Higashi School. that they use there. And Boston Higashi School focuses, most of the students at Boston Higashi School, it's partly a residential school, partly day school. Most of these students are at autism, you might say levels 2 and 3. They need more support. Most of the students find it challenging to communicate verbally, so they use assistive communication devices, and they tend to be in need for a lot of support. So this is what they developed for their students. And this is the one for the guys. And it talks about, we start with introducing Ryan, for example, learning about his body and how as one matures and goes through puberty, there's a lot of changes that occur as the person becomes an adult. And some physical changes that occur as well, in terms of where hair might grow. And then there's a discussion as to private areas, penis, testicles, and bottom, for example, identifying them, and that it's perfectly okay to touch your body. And there are certain parts of your body that you touch, and we think of those as public areas when people are watching. And there are certain other areas, the private areas, that you still can touch, but not when you're with other people. And in touching these areas, you might get certain feelings, as we see here. And that's okay. I just saw another question come up, so I'll get to that in a moment. And where can you touch your private areas? And the best place is your bed. Sometimes people think about the bathroom may be a good place as well. What if there's only one bathroom in the house? What if you're visiting a relative or a friend? Is this something you'd want to do in their bathroom? Or what if you're at a bus station? Definitely don't want to get involved in these behaviors in a bus station, but people tend to have only one bedroom. And with direct discussion, again, perfectly fine. And this is what happens when you touch your penis. It's going to change. And this is the location in your private space that you engage in this activity, but not where people are watching, because these are not private spaces. And then a reminder as to where it is perfectly appropriate to engage in these behaviors. And some other books that can be helpful. These two are very helpful. They are not written for people with autism or people with disabilities in general, but they still can be very helpful in understanding what's happening with your body, both for males and females. Redirecting inappropriate masturbation, that is often a challenge. And like with other behaviors we might want to modify, you want to redirect to where it is appropriate, and perhaps even scheduling this time as to where it's appropriate to engage in masturbation. And then finally, this can be really challenging, but sometimes you might need, or somebody might need, to teach an autistic person how to masturbate. And these are some of the resources, some of the resources that are available. So it's been great talking to you about this important topic, the topic of relationships and sexuality, and developing better understanding and supporting of autistic people. And now's a great time for questions. I see a couple of questions right here in the webinar chat. Encouraging socialization for a very verbal, high-functioning teen who is shy and overwhelmed. That unfortunately is very common. And perhaps the best thing to do is to identify what is that person's interests. Are there other people, or is there a group who might have that same interest? And maybe initially communication is done in a safer situation, perhaps through text. So it could be through instant message of some sort, or Discord, or some other sort of social media in which to text. And that can establish an initial contact. And then based on the person's ability, we move on from there, perhaps arrange to briefly meet at a particular place, a location. All right, someone who's struggling with son's hygiene, doesn't like deodorant, mostly for the texture. That can be a challenge, especially when deodorant is needed. I don't know the specific situation. There are some people who can get by without deodorant as long as they shower twice a day. It's just something you do at night before you go to bed, and in the morning when you get up. That may or may not be sufficient. I know there's many types of deodorant out there, and you may want to experiment with the different types. I mean, some of them you spray on, some of them you roll on, and they're certainly going to have different textures. How do I best encourage friend making with peers for my child who prefers adults? Oh yeah, I definitely prefer adults, or did when I was a kid. And the reason why is that adults were more predictable. They tended to have more patience. So when, for example, I started in the middle of a topic or a sentence, they'd say, oh no, what was that? Let's back up. And often peers don't have that patience. And so I ended up spending more of my time with adults, my older sister's friends. It also, I'd get back to interests. What are the interests of that child? And are there other people who have a similar interest that that child could interact with? So that's what comes to mind with that. I see that Chanique is here, probably to let me know that we've got 2 minutes left. So.
Yes. I was looking through and I see that's all the questions that we had on there, and I learned some things for my 22-year-old son that's very helpful. So I thank you, Dr. Shore, for taking this time out of your day to be with us today.
Oh, it's my pleasure.
We had his information up there for anybody who wanted to contact him.
Oh, yeah, that's an important piece. You're welcome to contact me with any questions. Send me an email. You should have a PDF available for this. If you don't, for some reason, you can always email me and get a PDF in living color.
Yes, the PDF is in the under resources. If you click on resources, you'll be able to get that PDF. But we thank you so very much for being on here with us today, and I'm thankful that everyone got some great information, because I did myself. We'll have a 15-minute break and we'll be on with our next speaker.
All right. Well, it's been a pleasure, and I look forward to seeing you again, either online or in person, however you guys set it up.
Thank you. If you'll click backstage.
Oh, okay, that's the next. Looking for backstage.
I just realized I was muted, so we'll start again. Thank you, guys, and welcome back. Let's get started with our next speaker. We have Dr. Carrie Magro. Thank you for joining us today, Dr. Magro.
Oh, I'm happy to be here.
So let me tell everybody a little bit about you. Dr. Magro is an award-winning autistic professional speaker, best-selling author, and autism consultant on the HBO series Mrs. Fletcher, and the latest season of Netflix's Emmy Award-winning series Love on the Spectrum, US. He started professional speaking 12 years ago via the National Speakers Association after he fell in love with theater as a child to help with his social and communication skills. Today, he has spoken to over 1,500 events during that time, including 2 TED Talks, a Talks at Google presentation. In addition, Carrie is CEO and president of KFM Making a Difference, a nonprofit organization that hosts inclusion events and has provided 100 scholarships for students with autism for college and counting since 2011. In his spare time, he hosts a Facebook page called Carrie's Autism Journey that now has over 250,000 Facebook followers, where he does on-camera interviews highlighting people impacted by a diagnosis to breaking down barriers in our community. Carrie's best-selling books, Defining Autism from the Heart and Autism and Falling in Love, I Will Light It Up Blue, and his latest, Autistics on Autism, have reached the Amazon bestsellers list for special needs parenting. So now I am pleased to present Dr. Carrie Magro. Thank you so much for joining us.
Oh, well, I'm so excited to be here. And thank you for everything that you're doing. We often say in the community, it takes a village. And to see the support that you're not only giving to our community members in Alabama, but across the United States by hosting this conference, it's just truly amazing. For everyone joining us, my name is Dr. Carrie Magro. I'm a professional speaker, author, and autism self-advocate. I'm really excited to talk to you about a topic very near and dear to my heart today when we're talking about bullying prevention. We have an interactive activity, as you can see on your screen. We think that we have about 30 key resources that we're going to share with you in today's presentation, which we hope you can use, whether you're a parent, a self-advocate, therapist, or educator. But we also often say it takes a village. So we would love for you to just participate in this interactive activity really quickly. We would like you in the chat box to tell us first your first name and why you're joining us today, where you're tuning in from, and what's your relationship to autism. If you're a parent, it might have been when your child was just diagnosed. If you're a self-advocate, it might have been when your parents or a family member may have told you about your diagnosis for the first time. So we'll spend about the next 2 minutes doing that, and I'll be going through the chat as well to introduce you guys. So enjoy. Hey, Jennifer, thanks for joining us. Hi, Supriya. Supriya is joining us, and she has an autistic boy. Hey, Ingrid. Ingrid is joining us from Murray, Alabama. She's a caregiver, a foster parent, and she works in the educational system. We'll actually be sharing some key resources that educators can use to help support the autism community, especially in your schools when it comes to the topic of bullying. Hey, Katie. Katie is joining us, and she has 2 autistic kiddos. Hey, Jessica. Jessica is joining us from Endeavor Elementary in Harvest, Alabama. She's a special education teacher who teaches children on the spectrum as well as others with disabilities. Jessica, I know that your work is truly making a difference. What we'll talk a little bit about today is how educators were really one of the significant factors of why I'm speaking in front of all of you today. All right, and as we continue going, feel free to, if you see somebody in the chat who you might share a similar story with, don't be afraid to message them, reach out, because again, a contact specifically might be able to help you within this community. But I am joining all of you guys today from Hoboken, New Jersey. I've been a professionally certified speaker for the past 12 years now. I was diagnosed with autism when I was 4. And it was really, really important for me when I got my degree at Seton Hall University in sport management. I realized that I was blessed with a lot of opportunities that many in the autism community just did not have. And it made me want to change career paths to focus on a full-time career speaking in front of audiences like your team today. So I have a quick intro video, which will share with you a little bit about my road from non-speaking to professional speaker. I was diagnosed at a time when the numbers of autism were about 1 in every 1,000 being diagnosed in the United States. Today, autism is the fastest growing developmental disability, which is why we need more educational opportunities like this conference to continue sharing resources and to continue to focus on the importance of the lifespan on the autism spectrum. So I hope you all enjoy this video.
Next guest is an accomplished public speaker and activist who has devoted his life to helping others. Not bad for a guy who was completely nonverbal for the first few years of his life. But once Kerry Magro found his voice, he had a lot to say.
My parents have always told me I'm special. So why am I special? And then later on, I realized that I'm even more special because I have autism.
Kerry Magro's childhood was marked with rough patches. He was completely nonverbal at age 2 and diagnosed with autism at age 4.
I just remember having difficulties trying to explain myself to the world around me.
When Kerry did speak, he struggled to express himself.
Most of my memories were simply just about that kid who wanted to communicate with the world around him, but didn't have the verbal means of actually doing that.
His mother, Suzanne, remembers watching her son have a hard time adjusting to the outside world.
He turned 2 and he was scared of everything. He was scared of the water. He was scared of the rain.
But as the years went on, Kerry slowly began to find his words.
When you can't communicate with the people you love the most in this world about even some of your basic needs, it gets really, really tough. So, but luckily, once I started talking, I never stopped talking.
Wow. This is a good point today.
Cindy Shu introduces us to an autistic man who's spreading awareness and understanding throughout the world.
And his latest way of educating people about autism is by making TikTok videos.
Received over 4.1 million views on TikTok. And I just had so many parents, educators, family members who just wanted to learn more about autism. And they were like, keep going, keep doing what you're doing because it's making a difference.
In college, he started a nonprofit called KFM Making a Difference, which awards autistic students with college scholarships. He later earned his doctorate in education. He's now a professional speaker on autism and inclusion.
We've gotten inquiries from people from Africa, Canada, the UK, and it's just shown me that we're not alone in this community. There are people impacted by autism across the globe.
He's written 4 books. His latest one is called Autistics on Autism. All proceeds will go to a scholarship foundation.
You are going to find 100 amazing autistic adults' stories of how they were able to navigate their adolescence and ultimately succeed in their journeys.
He says most publicly funded services end for autistic children when they age out of school, so that could be late teens. He's fighting to get resources for autistic adults through legislation and has this message for parents.
Never give up on your child. Never give up on getting them the best quality supports so they could live their best quality of lives, because again, it's a spectrum. And it's really about providing those resources across the lifespan, because autistic children will grow up to be autistic adults and we need to be ready for them.
And he'll keep promoting awareness any way he can.
So that's a little bit about my journey. And to kick us off today, just in honor of Black History Month, I just wanted to really quickly say it's really important for us in our community to not forget the Black community. What do I mean by this? Those in the Black community are more likely to be diagnosed later on average than white children in the United States. And often growing up, the representation of autism was that every single person with autism was a white male that had photogenic memory. And once they turned 21, you could win them $88,000. They could win you $88,000 on the blackjack tables. We now know today that autism is a spectrum. So not only throughout this month, but throughout the year, let's keep having conversations about those in our community who are often underrepresented, because we all need to be here for one another. So I hope this video gave you a little bit of a understanding of just my road. I grew up with laser focused key interests. I wanted to grow up to be the sixth member of the Backstreet Boys. And I also wanted to grow up to be the next Larry Bird. So growing up, I could tell you all 30 NBA teams and every single player on one of those teams. And that's why I got my degree in sport management at Seton Hall University before receiving a scholarship from the National Speakers Association to become one of the first openly autistic professionally certified public speakers in the country. It's given me the wonderful opportunity in the past 12 years, while also getting my master's and doctorates, to get the opportunity to travel the world. If you would like to stay in contact with me, I would love if you'd give me a follow on LinkedIn. That is the QR code on the bottom left of your screen. Let's stay connected, because again, it takes a village. Along that time, I've written 4 books based on my journey growing up with autism. I started peer mentoring for kids from the ages of 18 to 24 to support them on the road to adulthood. And one of the things that we continue to talk about was that they were reading books, but they were not reading any books from anyone who had autism. They were always just reading it from quote unquote experts, neurotypical experts. So I wrote my first book, assuming that it would just be a great Christmas gift for them and maybe my parents. But within 3 days, it became an Amazon bestseller for special need parenting. And it continued to give us a platform to continue talking about topics that are impacting the autism community today. Later, writing a book about love and relationships for those with autism, a children's book called I Will Light It Up Blue, and then also our latest book, Autistics on Autism. We also took our love of theater to become a consultant in the entertainment world. We've had the opportunity to work on films like Joyful Noise, Jane Wants a Boyfriend, all that feature some form of autism or disabled character, in the hopes of highlighting more representation in our entertainment industry as well. Along this journey, one thing that I realized right away is, first off, who likes free stuff? When I started speaking for the first time, I would go to so many different conferences and I would take a photo of every single slide so I didn't miss any of the information. You all have the PowerPoint slides as part of today's symposium that should have been shared with you. But if you scan the QR code at the end of today's presentation and leave your name and email, we'll make sure that you not only get the PowerPoint slide notes in case that you missed them, but we will also give you a list of free autism resources that you could take advantage of if you are just simply trying to learn a little bit more about our autism community. So during my time, I was blessed with so many opportunities to work with so many incredible groups like American Express, AT&T, PSE&G, PNC Bank, BlackRock, S&P Global, JP Morgan Chase, and so many more incredible financial groups. And I realized I was truly blessed, and I wanted to pay it forward by starting a nonprofit organization where I get the opportunity to not only provide that mentorship that I was just talking about, but we realized that a barrier to entry for so many autistic students pursuing to post-secondary education was the fact that they had challenges with testing. They had difficulties with that and received minimal scholarship aid because of that. So I started a scholarship program called the Making a Difference for Autism Scholarship Program. We have actually, ironically enough, had several winners from the Alabama area, including one who currently attends the University of Alabama. So we've given out 150 scholarships within the past 9 years, in addition to giving out 27 small business grants for small businesses that hire people with disabilities. It's really important as we have larger conversations about what happens to children with autism when they become adults, that we talk about the fact that the majority of autistic adults today are unemployed or underemployed. And we need to make sure that companies understand the untapped talent pool that we have in the disability community. So we started that grant program to support the small businesses that really understand that untapped talent pool. In addition, 100 of our scholarship winners actually wrote essays for our book, Autistics on Autism, in the hopes of helping individuals within our community understand those with autism from a first-person perspective. All those books are available to check out on Amazon. This last book, 100% of the proceeds of this book are going directly back to our nonprofit to support our many initiatives. So when we talk about bullying, there's so many different definitions of what bullying looks like in our community today. One of the things that I want to highlight, though, is that one of the concepts that I educate educators about in our school systems is the idea of more peer mentoring opportunities. Peer mentoring, on average, is more likely not only to build on social skills, but it's also going to help when it comes to bullying in our schools. And it also doesn't affect the bottom line. I'll talk a little bit today about how you could establish that as a way of stopping bullying within your schools. Because at the end of the day, when a peer intervenes and says these 7 words, what you're doing is not okay, a bullying situation is twice as likely to stop compared to when an authority figure like a teacher comes in and interjects in a bullying situation. And that's why our peer mentoring can have a really true significant impact when we talk about bullying. Also, I just want to see more disability awareness and acceptance in schools to help put an end to bullying. I often hear families who email me and say, I don't think the worst thing that could happen to me is raising a child who has autism. I think the worst thing is to raise a child who is cruel to those with autism. That is why in many of our communities, we are pivoting our conversations from autism awareness to autism acceptance, realizing that it's not only enough to be aware of what autism is, it's about being accepting, understanding, and celebrating our community for its very, very wide spectrum. So an overview of what we're going to talk a little bit about today. We'll have about 15 minutes at the end for question and answer. So feel free to write your questions in the chat box as we're moving along, and we'll try to get to as many questions as we can at the end. We're going to give you a little insight on what bullying is and how it currently affects our community today in 2024. We'll also talk about the current state of our autism community as well. Then we'll break down some of just my personal experiences and how bullying had stopped for me when I was in school. And then 7 measurable steps you can take to take a stand against bullying today. Again, whereas if you're a parent, a self-advocate, or a teacher. So first and foremost, based on statistics done by the Department of Education, 1 in 5 students in our public schools in the United States today are a victim of bullying. And those with disabilities are twice as likely to be bullied compared to their non-disabled peers, with those with autism being the highest prevalence when it comes to bullying situations, simply because of the fact that autism is a social and communication disorder, and some individuals are not able to speak up and advocate for themselves when a bullying situation occurs. One of the things we realized during COVID-19 was also the importance of having larger conversations about how to stop cyberbullying. When many of us had our kids at home and we were working virtually, it led to a lot of challenges because bullying was harder to track, and it was also harder to document. Documentation is such a huge pivotal key that for all parents who are joining us today, it's really important, especially hearsay in 2024 is not something that we can consider. We need to make sure that we are documenting as much as possible. So when we do go into those child study team meetings, when we do go for those IEP meetings, we can talk about bullying and how we could actually set parameters, which we'll talk a little bit about later, on how you can prevent bullying overall. Based on the school crime supplement, it says that 9% of students in 6th through 12th grade are cyberbullied. So we're seeing a lot of middle school students and high school students who have been bullied in different mediums of online communication. We need to be aware of the sites, and we also need to have more open and honest conversations with our kids about where they are going online and what conversations that they are specifically having as well. So there are some actual terrific resources I'd highly recommend if you're learning a little bit more about this, or you've ever had a loved one who has dealt with cyberbullying. The Cyberbullying Research Center provides information about the nature, extent, and causes and consequences of cyberbullying and what that looks like compared specifically to acts of bullying. In addition to that, if you ever want to learn more about this and how to prevent it in your schools, I would definitely recommend the Pacers Bullying Prevention Center. They're one of the leading experts in the realm of bullying prevention in our K through 12 schools today. They're available to check out at pacer.org. And then finally, Autism Speaks has about 43 toolkits, which are available for all of you to check out. Everything from the first 100 days a child is diagnosed with autism, all the way to later adulthood with autism in terms of getting a adult diagnosis of autism. And one of their toolkits, their school toolkit, actually talks a little bit about bullying and what you can do to prevent bullying in your schools. So when we talk about bullying, there are so many leading experts who have totally different definitions of what bullying is. But one theme that many of us have is that bullying simply is this. Bullying is an imbalance of power. The bully simply wants to get power over somebody else. And when we educate our loved ones about that, bullying becomes such an easier thing to understand. Somebody wanting to have power over somebody else. And one of the ways that bullying stopped for me, which we'll talk about a little bit later, was understanding that and role-playing different scenarios of why a bully would do that and how to actually talk about that and how to stand up for myself. Bullying can also be considered things like unwelcome conduct, graphic or written statements, threats, physical assault, and other conduct that might be physically threatening, harmful, or humiliating. One thing that we need to do a better job of, in one of the earlier slides, you saw that I had a slide that said October is National Bullying Prevention Month, where in many schools I go to speak at, they hire me to be an assembly speaker at their K through 12 school to teach students the differences between bullying and conflict. See, what's happening in a lot of our schools right now is there's documentation being done on bullying, which isn't actual bullying, it's actually conflict. The differences between conflict and bullying is that bullying is typically reoccurring, and conflict can be simply a misunderstanding that two peers have in a potential situation. It looks at different situations as well, but when we educate our kids about that, we can actually really focus on those really serious cases of bullying that are happening in our schools today. One of the leading causes of bullying is simply ignorance. There is still such a stigma around so many individuals with disabilities that they're stupid and they're easy targets. And that couldn't be further from the truth. Some of the most intelligent people I know have a disability. There's also not enough awareness. I can't tell you how many school districts I go into who the students have never ever heard the topic of bullying before. That's why we need to provide more educational opportunities in our schools, even our Title I schools, who might have limited funding, being able to reach out to our local legislators to start anti-bullying task force so we can stop bullying at its core, because it's impacting a lot of our kids in our schools. There's also not enough education of the harmful effects of bullying to students, which we'll talk a little bit more about today in case studies. If you're ever trying to educate young individuals about disability, I would highly recommend several different projects to have a conversation about autism and disability. Disney Plus has 2 Pixar shorts that you can introduce to your children to help them understand a little bit more about the disability community. The first one I would like to highlight is called Loop. Loop focuses on a young girl who communicates via her phone via a text-to-speech device. It's also a great one to highlight an individual of color during the month of Black History Month. In addition to that, Float. Float was actually written and directed by a father who has a child with special needs. And the premise of this Pixar short is that the young kid learns the ability to fly, but unfortunately, because of that, is often judged because of that. And it talks a lot about different metaphors that some parents feel like when they have a child with a disability. So the current state of the disability community today, we have about 1 in 5 Americans who have some form of disability, making up the largest minority in the United States. Often, though, it's one of the most underrepresented because of the fact that some individuals with disabilities have high support needs and don't necessarily have the ability to speak up for themselves when they are in a situation where they need something specific. In addition to that, in our school systems, 1 in 6 children have some form of cognitive disability. We're seeing more individuals also gain their disabilities in adulthood, especially when we talk about mobility disabilities as well. So we need to really look at the concept of age and wellness as we continue to pivot our conversations in our community. Many diagnoses also, such as ADD, ADHD, and autism, have been on the rise for decades. Again, when I was in 1992, the numbers were 1 in every 1,000 being diagnosed, and today it's 1 in 36. EdWeek indicates that also only 1 in 3 educators have any form of professional development focus on those with disabilities, which is really, really unfortunate. One area that we need to have a larger conversation about is teacher bullying, especially when we talk about making sure to weed out teachers who are not necessarily focused on the best intentions of our children. Although it's in many isolated cases that this happens, there have been more reports of teacher bullying in our schools in the past few years, which have actually led to some homeschooling situations. As a way of having larger conversations about bullying in our schools, though, one of the things that I do is every single place I go to speak, I bring a tripod and a camera, and I sit down with self-advocates, not only to give them an opportunity to nurture their own self-advocacy by sharing their stories for the first time, but also debunking myths around disability in our community. And I met this incredible young woman named Heather, who had a very unique story of being bullied that she wanted a platform to share with the world that I wanted to share with all of you.
I was told all kinds of things. I was told that I was not trying hard enough. I was told that I was lazy. I was told that I was stupid. I was told that I was slow. And I know now that none of that was true. I just recently graduated college with all honors and magna cum laude.
Can you tell me a little bit about the shirt you're wearing? Because it's really cool.
It says autistic. Ask a question, get an honest answer. A very honest answer, because I just speak what I feel, and that's that. I ride horses competitively. I have a horse right now. She's on full lease. Her name is Silverbell. And I do theater, I do acting, singing, and dancing, and I love to play sports too. I'm active in Special Olympics. A lot of my challenges were because I was not diagnosed and we did not know what was wrong, and I was bullied a lot, and I continue to be bullied sometimes.
How does that make you feel when bullies actually go about doing that? Because I used to be bullied too.
It's really difficult because for me, in my case, my bully had been an authority figure. So, if a person is a leader, it leads other people beneath them to continue bullying. So it is very complicated. And it's really upsetting. Like,
Understandable.
I just wish people understood, like, people don't understand that, like, they give, because, like, with autism, when you can't always say, you can't always describe your intentions or, like, emotions that well, people tend to label them for you when it's not accurate.
Is there anything else that you would like for people at home to know about you and your story?
If you're a person with autism in your class or your workplace, please take them under your wing and befriend them, because that's what they need most, is a friend, like a real friend, a best friend. And I was lucky enough to find that, and I have some of the best friends in the world that anybody could ask for, but for a long time I didn't have that, and it's really, really hard. And if you know somebody with autism, I'd really, really, really encourage you to take them under your wing, befriend them. They like some of the same activities that you might like. A lot of them can talk to you and hold conversations just like me and you.
Yeah, exactly.
So be their friend and open up and encourage them, invite them to your parties and make them a part of your social group.
So I love her explanation because it shows, and I share this in many of the school assemblies I do with students, the idea that bullying is not only a school age problem. This is something that could happen after school, and having that education is really, really important.
What would you like for people?
I love transitions. And the second video I wanted to share with all of you is from a young woman named Kristen. Now, when we talk about the idea of bullying in our schools, when we talk about lasting challenges, Kristen's story had a very devastating impact on her. And this was what she wanted the world to know about it.
I don't know about you.
I've been through a lot, and if you just give me a chance, I'm a very bright, talented, pretty cool person. I'm a painter. I'm a writer, and I've written a couple books. And I like to do some acting. I'm very multi-talented. I also like to make music. Actually, I could say my greatest accomplishment was pushing through. I have because of the bullying, I have a lot of depression that I've actually, can I say, I tried to commit suicide many times, and something in my mind, I don't know, just tells me that it's gonna get better. And then I'm gonna be something one day, and
You aren't going to be something one day. You're something right now.
I don't feel that way.
But you do amazing art. You've kind of like flourished. I mean, you got the punk rock thing still going on. So I mean, you do have things going on in your life. And I was a victim of bullying too. I'm so sorry that you had to go through that.
It's quite often, I've tried to rack my brains around it, and it's just, I think one of the biggest things is that I'm just alone all the time. I don't have a group of friends, and I get attacked in public by people. I'm a very easy target, and this happened my whole life, and it happens so often. I'm almost afraid to leave my house.
I just want you to know, it's like there are people out there in our community who want to be your friend.
Make everybody feel like a friend right now. Make everybody feel like also somebody right now. This is such a powerful message. And when we talk in our schools, I do about 40 school assemblies each year, and I would love if any parents who are joining us today would like me to speak at their schools. My contact information will be at the end of today's presentation. But one of the things that we talk about in so many middle schools and high schools is the fact that the second leading cause of death for individuals from the ages of 6 to 25 is suicide. And bullying can be an indicator of some of those situations happening. Now, when we have those conversations with the students, often many school districts will say that, oh, kids will be kids and bullying is just a rite of passage. Bullying is not a passage that any child deserves to have, regardless if they have a disability or not. So we need to have larger conversations about it. We need to talk to our CPACs, our PTAs. In addition, we need to ask our local legislators to support anti-bullying legislation, to have larger conversations about it in our K through 12 schools. in New Jersey, where I'm based in Hoboken, New Jersey. We have an anti-bullying task force, and every single one of our schools has an anti-bullying specialist who actually go about bringing in speakers to actually have conversations about this with the students and also the educators. So my personal experiences with bullying, again, I was bullied so much when I was growing up simply because I was the quiet kid. As the NBC Today Show video mentioned, once I started talking, you couldn't get me to stop talking, but I didn't actually speak in complete sentences till I was 7. So I lash out, and because of that limited speech, would make me a very, very easy target in my mainstream inclusion classrooms. And bullying continued through public school. I was in a multi-handicap classroom until 4th grade, where there were a wide range of challenges. And one of the hardest, most difficult points was when my class was called the retarded class. I was mainstreamed in mathematics for the first time. And during that time, there was still such a stigma because we were the only one classroom who actually had any form of disability. And I went from a 3.95 GPA all the way down to a 3.81 because of the fact that I was dealing with bullying almost on a daily basis. So how bullying actually stopped for me was, I felt like no one understood me. And that's when I started talking to my parents about how we could actually go about the process of finding a program that was best suited for me and my needs. This led to my parents suing our school district for an out-of-district school placement, where I really got involved with theater. Theater helped me role play different scenarios where, for the first time ever, I learned what a bully was. For so many years, I would befriend bullies because even though I was receiving negative attention, it was some form of attention. And as an only child who didn't have a lot of peer-to-peer interaction, I kind of latched on to that. And I know so many other kids in our community who do the same exact thing. So when we talk about this, one of the things that I actually brought to my theater teacher was the idea that, like, I had been bullied before. So we would actually role play different theater scenarios with the other students on how we could stop bullying. So for example, one day I told my theater teacher that, oh, you know what? One of the biggest comments I get is, oh, Carrie, you have autism, but you're so stupid. So she kind of helped me understand that, like, instead of saying like, shut up, you're stupid, instead of attacking the bully and letting them know that you felt hurt by that situation, I would simply tell the bully, well, you know what? Sometimes I do stupid things. And no matter what you say, I'm always going to want to be your friend. And that's actually ironically how bullying stopped completely for me. By not giving the power to the bully and finding different scenarios and different social skills to help me understand that, bullying had almost went away completely. Again, there are some people in our nonverbal and non-speaking communities who might have challenges doing situations like that. And that's why we're going to talk a little bit about steps that you could advocate for today. Bullying almost stopped, and I was able to pursue so many of my hopes and dreams today. So finally, before we open it up to Q&A, I'm going to share a quick breakdown of 7 steps to take a stand against bullying. The first one is, and this is why you guys will get the PowerPoint slide notes, because I know there's a little bit of text here, and I want to make sure you get all the resources, including the URLs, because they'll provide valuable information around this topic. The first one is the easiest one. Start the conversation. We can't be afraid to talk about this because individuals with special needs may not realize that they're being bullied or may not be able to communicate what's happening at school or in the community. The first step is to get the conversation started so they understand what bullying means and why it is not okay. It's also important to help teach a child about the difference between appropriate and inappropriate treatment from classmates. During these situations, it will be really, really helpful because on this link from thebullyproject.com, you'll also learn a little bit about the differences between bullying and conflict. So if you have a child who wants to talk to a teacher about being bullied, they'll understand what it is and if it's actually a conflict. The second one, develop a plan. I believe that all of our students should be sitting in on their IEP meetings for at least 30 minutes, not only so they can understand more about their accommodations they're receiving and their strengths and weaknesses, but for those who might be bullied, it's also a great resource for them to combat bullying. You could work with your child's study team to map out precautions to put in place to prevent bullying, as well as procedures to stop it if it does happen. The IEP should include mechanisms to keep your child safe based on his or her unique abilities and challenges. So speaking and communication is typically one of those challenges that does come up during this situation. So Pacers.org came up with a publication where you could learn a little bit more about not only how to establish this in the IEP, but also social stories and visual schedules. So you could actually get a child to sit in on their IEP meeting for the first time. Number 3, teaching tolerance. It's really important that in our schools that we're bringing in guest speakers to educate students on the idea of tolerance and also lessons in compassion. It's really important that we continue to teach tolerance, and that in many of our school districts today, during the month of October for National Bullying Prevention Month, we also have Respect Week, where we talked about the importance of promoting kindness. I can't tell you how many school districts have contacted me, especially with April and the Autism Acceptance Month coming up, about just wanting to have a speaker come in to talk about the idea of autism and kindness, because we don't have enough kindness in our world, and promoting it even just a little bit can go a long way. Increase awareness and acceptance. We need to just have a larger conversation about how to talk about disabilities in our school. One way of excuse me, I had something caught in my throat. One of the ways that we talk about that is during National Disability Awareness Month, during the month of October, we encourage school districts to actually do activities like Disability Celebrity Bingo, which is ironically enough how I first learned about my autism diagnosis for the first time. I was in a social skills class. We were learning that Michael Jordan has ADD, Magic Johnson has ADHD. And at the end of the class, the teacher says to all of us, all these individuals are special, just like you. So I raised my hand and I asked the teacher, so why am I special? And that was the first time that anybody had ever told me I had autism. And it was life-changing. And for so many years of not knowing what autism really meant to me, everything became full circle for me. We also need to encourage self-advocacy. Your children, by learning a little bit more about their diagnosis at earlier ages, can help them not only lead to, hopefully leading to reaching developmental milestones, but also in the terms of bullying that they may be receiving in our schools. While parents and educators can put plans and supports in place to prevent bullying, it's also very important to teach students to advocate for themselves to the best of their abilities. If you go to Pacers.org, they also have a self-advocacy action plan where they'll actually explain to you the definition of what self-advocacy is, how you can explain that to students, and what are some proactive ways that during the academic year, a student can self-advocate for themselves, such as sitting in on IEP meetings. Number 6, learn your rights. I definitely recommend for every parent joining us to just brush up on the Individualized Disability Education Act as a way of understanding your rights specifically for your child based on the United States government. One of the other things that I definitely recommend is that Stop Bullying is a government website which actually has laws, breakdown of all 51 states and what bullying laws are currently placed in those states. It will actually also talk a little bit on that website about the actual legislation that's being done in every single state, such as my state, New Jersey, which requires anti-bullying specialists in each one of our school districts. And then finally, speaking up, whether you're a parent and you know your child is bullied, a teacher who sees that bullying is happening at school, or a student who feels that you're being bullied, the first thing you should do is speak up. Let school administrators know about what is happening and tell them that bullying is a violation of the individual's rights, as well as his or her IEP. And the child isn't doing enough to stop the bullying and prevent it from happening again, you can reach out to an advocacy organization for assistance. Don't be afraid to hire an advocate. It can be really beneficial for you, especially sitting in on your IEP meetings in addition to other supports as well. So finally, bullying, it can be a lifelong issue. And when we have the naysayers who say things like sticks and stones will break my bones, but words will never hurt me, it's important that each one of us who are joining us today use your voice, because your voice can make a significant impact in our community. I wrote a letter called a letter to those who bully people with special needs that went viral on Upworthy, which led to a national conversation several years ago about bullying, where we were receiving national attention about this topic. And it just goes to show that one small voice can make a huge, huge impact. Whether you're on social media, you're involved with a local community group, continue to talk about this topic, because that's how we're going to make meaningful change and let our children have a peaceful life and be able to go after what they want to achieve. I like to say that autism can't define me, and I define autism. And I can only hope that all of you joining us today, regardless of where you are on this specific journey right now, can go out there and define your lives and your journeys in the way that you best see it every single day. And if you need any help getting started in those conversations, these are the ways that you can stay in contact with me after today's presentation. I thank you all so much for joining us for today's presentation, and I would love to open it up to any questions that you have at this time. Feel free to write them in the chat box, and we will try to get to as many as possible. On the left hand of your screen, just as some housekeeping notes, you can scan this QR code with your smartphone camera to get the PowerPoint slide notes, in addition to a free list of autism resources. And if you are like my dad has a Razer cell phone, no judgment. You could go to the link bit.ly/carry-slide-notes to receive all the information from today's presentation. And without further ado, we will open it up to questions. And it looks like we already have a few that are coming in. So this is awesome. So Shanique writes, hi, Shanique. My child has very low language. Are there some social stories or books that you could recommend me to help explain how to manage bullying to him? I have social stories that could help with the overall IEP process. Nothing specifically comes to mind in terms of social stories around bullying, but if you go to iamdetermined.org, and I'll actually write it in the chat so you could take advantage of that link. On their website, they have PowerPoint presentations, which are just social stories, which can actually introduce a child to their IEP meeting for the first time. I also recommend going to teacherspayteachers.com. On that website, we often have teachers who post different social stories on a wide range of topics that are impacting K through 12. So I'll definitely post that in that as well. In addition, again, guys, if any of you have a child in school, feel free to reach out to me via email. We might be able to work with your school. We've worked with Title I schools with very limited funding to help them through the grant process of bringing in a speaker, to working with PTAs who fund and fundraise to bring in speakers to talk about these topics, not only during April for Autism Acceptance Month, but October for National Bullying Prevention Month. Carrie writes, hey, Carrie. One difficulty we have in schools is that many times the other children who don't know that a student's autistic, we can't disclose that information to them. What strategies would you suggest to educate other children and teens about autism that leads to acceptance and not trying to guess or point out who is the person with autism? Well, Carrie, the importance of that could be as simple as, for example, a celebrity disability bingo class. Having the opportunity to normalize disability in our schools is really, really important, because nothing about us without us. There are so many individuals who might have invisible disabilities where somebody might not know that somebody's going through constant pain in our communities. In addition to that, I continue to say that not only myself, but so many amazing speakers who you've heard from at this conference, like Stephen Shore, go around the country and speak in our schools as part of assemblies and staff development. So if you have a teacher, a support system, definitely tell them to reach out. We might be able to do something to do an educational lecture to help the students understand a little bit more about autism and kindness as well. In addition, look at Disney Plus as an entertainment property that might be able to help, in addition to PBS Kids, has Daniel Tiger's Neighborhood, which has a character in there who has autism. Hero Elementary has a superhero who's on the autism spectrum. These are just great ways of actually leading to larger conversations about what that looks like in our schools. Shanique came in with a few more questions, and then everyone, if you have any questions, feel free to write them in the chat box, and we will try to get to as many as we can. Shanique also wrote, what are the best ways to communicate with my child's school if I'm concerned about his social interaction and possibly bullying? How do I start? He doesn't have an IEP yet. Well, if he's in birth to 3, there are still conversations around 504, which you can talk with your specific school district with, as long as, or not specific school district, but your child's pediatrician to help with these matters. If the child is older than 3 years old, he should be, and is in anywhere from pre-K up, should be receiving some form of IEP if he has a diagnosis of autism spectrum disorder. So that might be something to talk to your child's pediatrician about, and then have a larger conversation with a guidance counselor or school psychologist who is part of that specific school system. And then Shanique writes, I am a single mother and have a child on the spectrum. How can I best increase my child's circle of support? Yeah, Shanique, one of the things is supporting groups like Autism Support of Alabama, looking at Autism Society affiliate chapters who might have specific support groups who can help build your child's village. Many of these Autism Society affiliates, they have about, I currently serve on the Council of Autistic Advisors for the Autism Society of America. They have over 60 affiliate chapters throughout the United States. If you just go to autism-society.org, you can learn a little bit more about which programs are within your area and see if they have any support groups. They might have online support groups on Facebook groups, or they might have specifically something in person, which might be able to help build on your child's village. I would also recommend the ARC of the United States. They have 51 affiliate chapters. So they have an affiliate chapter in at least every single state, at least one in every single state. And you can check them out at thearc.org for more information about that. Do we have any thoughts, questions that are coming in? Feel free to go to the bottom of your screen and post them in the chat box. And while we're doing that, one of the things I'll say is when you scan that QR code or you go to the link, I consider testimonials the greatest compliment. If you learned something new and would like to leave me a few positive words, I would definitely greatly appreciate it for our marketing materials as we continue to speak in more of our schools and more of our autism related groups about autism to normalize it in our community. All right. Well, thank you all so much. I don't see any more questions coming in, but I appreciate all of you for joining us today. Again, those are the ways that you can stay in contact with me in addition to getting the resources. I just want to give a very special shout out to Autism Support of Alabama as a thank you for having us today. We're going to be donating signed copies of each one of our books for your team's resource library to continue that conversation around educating people around autism. Thank you again for having us.
Thank you. We so appreciate that. And we thank you, Mr. Magro, for coming on today, dedicating your time to be with us today on our virtual conference. We appreciate it. We have learned so much. I had my notes and I have some things that was very helpful to me, as I know to others. So we thank you for your time. And he has this scan up there, so everyone reach out to him and fill out the code. If you have any questions, reach out to him on his different platforms. We thank you, and we'll have a 15-minute break. Well, no, we'll be starting. The next one starts at 2 o'clock. The next one starts at 2 o'clock since we had to put that on the end. But thank you so much, Mr. Magro.
Anytime. Thanks all. Have a great rest of your day.
Thank you, Carrie.
Thank
Take care.
you.
All right, everybody. I'm frozen. Mm. All right, everybody, can you hear me? Okay, good. Thank you. Okay, well, we're going to get ready to introduce our next speaker just a few minutes early, just to try to stay and accommodate everybody's time. We have Dr. Whitney Mead, and let me back up and say that we are recording. We've recorded all day. And for those that are participating today, we will be emailing you and give you access to all of these speakers again. And so the recording today will be sent to you. And then, of course, if you haven't been able to see, but in your resources on the Zoom, there are all of the handouts from all of the speakers today. So you should be able to access that right now and all day. And so anyway, you will have access to all of this information in your inbox, so you can go back and listen to it. Okay, moving right along, I'm gonna introduce our final speaker, Dr. Whitney Mead. Dr. Mead holds a bachelor and master's degree from the University of Alabama. She holds a doctorate from Auburn University. Her work has been in both the K-6 platform and the 6-12 education. Most recently, she was an assistant clinical professor at the University of Alabama in Huntsville. She is currently a middle school English language arts teacher in North Alabama. So I am pleased to introduce Dr. Whitney Mead to you. Thank you for joining us. You're on mute, Dr. Mead.
Good morning or good afternoon, I guess. And at this point, let me shift gears, make sure you can see my PowerPoint here. Okay. If you are having any issues and can't see my PowerPoint for any reason, let us know in that chat box and we'll problem solve that. So I'm Dr. Whitney Mead. I have been an educator of some type at some level for 25 years now. The other day, somebody asked me that and I had to kind of pause because I thought I can't be that old. But today we're going to talk about using visual supports, and we're going to start out talking about sexuality and what sexuality is and what encompasses that and why it makes so many of us so uncomfortable. And then from there, we'll move into actually what are some visual supports that we can use to teach these skills that are just so difficult for not only our kiddos but ourselves, because they are things that we may not have experienced or understand ourselves. Okay, so first thing, anything related to sexuality, to our bodies, to how we interact with each other with our bodies is really a taboo topic. It's not something that most of us are comfortable with. And for most of us, the idea of somebody who has some type of a disability being a sexual being is really difficult for us to grasp and to really think through, because they require help in so many other areas of their life that we can't imagine that they would be sexual beings. However, they are. And so I'm going to go ahead and just put a warning out there. If you have kiddos with you, you may want to turn your screen, just because I am going to show you some pictures as we get into the visual aspects of some different things that you might want to consider if you are someone who is in a position to really be teaching an individual with autism what it means to be sexual, to have sexual relationships, and to even feel sexual feelings. So sexuality doesn't simply involve a one-off talk about sexual intercourse and how babies are made. It's not we talk about the birds and the bees one time and it's done, we've covered it and we're moving on. It's broader than that. Sexuality is about who we are, and not just what we do. It's an intrinsic part of our self-image. It's our self-esteem. And learning about sexuality has to be an ongoing, lifelong discussion. Even with our typically neurodeveloping children, it has to be an ongoing discussion because our bodies are changing, our feelings are changing, and we have to have open discussion with them about what those things are so that they understand what those mean, and they know what to do with them. When we keep topics like sexuality and sex completely taboo and we don't acknowledge those desires, that's when we start to have negative repercussions because we're engaging in behaviors that we don't understand and we've never been given the right education on. So we want to start today realizing that sexuality is a conversation we have to have from the time we have a kiddo until they are in a committed relationship and we feel like they've got the tools that they need to be successful and or they know how to go get the information that they need at that point. So a little bit of history about why it's such a taboo topic. Sexual bias can actually be traced back to the Puritans and their sense of ethics. We also struggle with the intersection of where religion and science and their views on sexuality. Let me make sure we're good. Okay. And, you know, we have some very strongly attached religious beliefs in what isn't and is not allowable when it comes to sex and sexuality. And so for many individuals, sex is considered a sin, and or they hold the view that it should only be done with the intent of reproducing offspring. However, other people hold very strong beliefs that sexuality should be explored openly, and that we should have the freedom to engage in those behaviors. Long time ago, sexual pleasure was considered a disease or a sickness. If you experienced an orgasm, you were having a fit of out of your mind craziness. And so we didn't honor a lot of those feelings because they were so closely tied to our religious beliefs. Oh, why? Well, there it goes. So in the 20th century, we had a shift. Sex and pleasure became normalized. The concept of pleasure became a central focus, whether that was pleasure from a partner or independent pleasure. We also started to really educate people that healthy sex included experiencing orgasm, and that if you were doing it right, it should feel good. And so we kind of took another detour where now if you couldn't experience those sensations, you were inadequate or you were faulty in some way. Now, because most of our individuals with autism or disabilities tend to experience things much later in life because of the nature of their needs, we tend to develop this view that those with disabilities are sexless, that they are asexual, or that they are in a childlike state for much longer, that they are almost eternal children because they aren't developing and mastering skills at the same rate as their peers, where the reality is that cognitively, they may not be developing some of those skills, but physically their bodies are still developing at the same rate as their peers. And so we get into this intersection of what cognitively or developmentally does somebody understand, but biologically, where are they at in their development, and do they understand what that development is and what it means for them? So we've had a fear of somebody with a disability experiencing sex and being a sexual being for years and years. We've tied it back to the Puritans, but back in the 20s, much of the nation actually went so far as to pass laws where we forcibly sterilized individuals with disabilities. And if you work with schools or disability education, then you are familiar with this young lady. Her name was Carrie Elizabeth Buck. And she is most closely associated with a lawsuit over the fact that she was forcibly sterilized. So back in the 20s, people who were afflicted with hereditary forms of insanity that were recurrent, whether you were considered an idiot, an imbecile, if you were feeble-minded, or if you had fits, which we now know are epilepsy, you would have been subjected to a forced sterilization law. And we talk a lot about the Nazis and the eradication of the Jewish population in Europe with World War II, but we very, very rarely discuss the fact that our forced sterilization laws were also tied to a eugenics movement here in the United States. And so just looking at one state, between 1924 and 1979, Virginia alone sterilized 7,000 individuals who were considered disabled. And unfortunately, this act has never been deemed unconstitutional. And in some states, while it's not routinely practiced, this law, these acts continue in the law books. So in some states in our nation, a parent could choose to sterilize their child even today because we've never revoked those acts. Now, in 2001, the Virginia General Assembly passed a joint resolution apologizing for the misuse of scientific information. And they agreed to compensate individuals like Carrie Buck that were forcibly sterilized. But the damage has really already been done. It perpetuated that opinion that those individuals who were disabled could not be sexual beings and should not be sexual beings because they did not have any capability to learn or to engage in those behaviors safely and appropriately. And at the time of Carrie Buck, society was terrified that somebody who would fall into those categories of idiocy and imbecile would reproduce, and that we would have this overrun society with individuals who could not be what were considered productive members of our group. So between 1950 and 1956, there were 59,000 people forcibly sterilized. So we want to understand that that really does play a role in how we view people who have disabilities. Now, this is the actual act. This is in my handouts if you want to go back and take a look at it. But we sterilized individuals either through a vasectomy or we removed their fallopian tubes. And in some cases, we did a full hysterectomy. But it was in order, if you look at that second bolded statement, it says, whereas human experience has demonstrated that heredity plays an important part in the transmission of sanity, idiocy, imbecility, epilepsy, and crime. Okay, so we would forcibly sterilize you for any of those reasons. And this is just kind of a timeline of how we went from those thoughts and to where we are today. If you are a child of the 80s, then you remember the white child who was diagnosed with HIV and some of the changes that came about because of that. His name was Ryan White. And the AIDS crisis really forced our nation to reevaluate what we thought of sex and sex education. People were terrified of HIV. We didn't understand how it was transmitted. It was considered a gay disease, even though Ryan White received it from a blood transfusion. but it was the catalyst that caused professionals to stop and go, we have to do a better job of teaching not only those with disabilities, but everybody about sex and about how to be safe if they're going to engage of sex. And so you can see that led to, in the 1990s, every state had a mandate for AIDS education. And this is where we see the first published guidelines for actually teaching sex education in K-12 schools. Now, as time has gone by, some of those standards have gotten pushed into home ec, health classes. In the 90s, they would have been strongly taught. Now they're kind of in the wayside because depending on where you live in the country, we run back into that blockade of religion and sex and the intersection of the two, and who wants what taught in what setting. In 2004, there was a research study published that found that abstinence-only programs were misleading, that children didn't understand what that really encompassed. And so we may have seen decreased numbers of physical intercourse, but we were seeing increases in other types of sexual activity. So by 2011, polling in the US showed that 90% of parents supported sex education in a public school. And then by 2014, 22 states and the District of Columbia mandated sex education, while 11 other states mandated HIV education. Now, I've taught in public school in the last 25 years. I've had kids in public school. I honestly can't recall any type of formal sex education being taught in a classroom to students that came from some kind of comprehensive, sequential, research-based curriculum. There may have been on the fly, little lessons done, but nothing organized. And so honestly, a few years ago, when this topic really came to my attention, I was shocked to discover that we really do have a curriculum in place that is available for parents and or teachers to access, to know what to teach and the sequence of which to teach. Now, one of the things that we have to recognize, it's all about perspective. If you look at the picture on the right, it's just a mom holding her belly. There's nothing that suggests that she's disabled or that she's less capable of caring for her child. But if we look at the picture on the right, we can see that she has some physical disability, or on the left, we see she has some physical disabilities, and all of a sudden she is considered less than. Interestingly enough, the HIV/AIDS community and the homosexual community has actually been one of the biggest advocacy groups for teaching individuals with disabilities about sex and sex education. It has not been the mainstream group that has advocated for those practices. So what's healthy? What do you and I do that we maybe don't want to admit to? First thing, we appreciate our bodies. One of the things that breast cancer awareness has brought to light is that concept of sexual being and how we view ourselves as a sexual being. Because if you have a double mastectomy and you no longer have breasts, there is a sense of no longer being a sensual woman attached to it. And so you have to find other ways of feeling that femininity. So we definitely have aspects to us where we appreciate our body. We have the capability to recognize the process that we're going through during puberty. Some of us have sexual relationships for reproduction, and some of us just do it to have the experience. But we want to be sure that we're understanding as adults how we interact with other genders. How do we affirm and show respect to other people who may have different opinions about sexual identity or sexual orientation than what we hold? We also are learning about, what is an abusive relationship? What's a healthy relationship? When is somebody trying to exploit somebody? And so all of these things are things that we learn and discover as we become healthy sexual adults. Okay, so here's a few more. We avoid contracting or transmitting diseases. We are able to assess our own values when dealing with pregnancy. We know how to seek medical care. We know how to demonstrate respect. We know how to choose and how to say no when we don't want to be involved in something. So our end goal in teaching sex education and sexuality to those with autism would be that they reach the point of having a sufficient number of these skills to make them safe, and to allow them to engage in the behaviors that they would choose to engage in. So when we actually hone that farther down in, let's get a good definition here. So sexuality is a central aspect of being human throughout life. It encompasses your sex, your gender identity, the role that you hold, your sexual orientation, your feelings of eroticism, pleasure, intimacy, and reproduction. Sexuality is experienced, it's expressed. You can do those things through thoughts, fantasies, desires, beliefs, attitudes, values, your practices, your role or the types of relationships you have. And sexuality can include all of those, even though only few of them are expressed to other people. Okay, so Dennis Daly came up with this concept of the circles of sexuality, and it took all of those things and lumped them into categories of skill sets. So the first one is sexualization, and it's recognizing that sensuality is used to apply influence, to control, or to manipulate others. And all you have to do is look at American advertising to understand the concept that sex sells. People are drawn to sexuality. And so, you know, we have media messages, we have flirting. You know, nobody is going to go eat a hamburger when it's 90 degrees and in their skivvies and lick it down their arm. But there's something sensual about that idea that attracts people. Okay, and so that's one part of our individuals that we have to recognize. We have to teach them when something is being advertised through sexualization and how it fits into what would be black, what's white, and do we need a hamburger because of what we're seeing, or do we need a hamburger because we're truly hungry? Now, sensuality involves our awareness and our experiences related to our body image. It also involves the exploring of the sharing of our body or the exploration of somebody else's body. Sensuality deals with recognizing what we find engaging. You know, certain types of art can be very blah to somebody, whereas somebody else might find a piece of art very sensual because of the curvature or the lines or the coloring that's being utilized. Okay, so sensuality has to do with that sense of pleasure, of what we find attractive, what we are drawn to. And then intimacy is that mutual closeness with another person. And there are lots of levels of intimacy that we have to teach. Intimacy can be caring about somebody, sharing dreams and aspirations or frustrations with somebody, and that person is a special somebody. You know, so I may have a secret desire to achieve something in life, and I don't share that with the world. I only share it with my partner. And that's a form of intimacy, just as much as being in a physical situation where we're being intimate is a sense of intimacy. But there are lots of things there involved, you know, being vulnerable, being willing to trust another person, being able to disclose those feelings and those emotions with somebody else. And then we have the circle of sexual identity and how we perceive ourselves as physical beings. And this one, for me, is difficult. This one goes back to being very tied to religious practices. You know, when we're talking about somebody's biological sex, what gender they might identify with, how they choose to express their sensations of their biological gender, what kind of role they have. You know, it's very uncommon to find a stay-at-home dad. You know, we typically associate that with a female being a stay-at-home mom. And so when we challenge some of those long-standing thoughts, we have to really think about what's that doing to our sexual identity. Is a stay-at-home dad less masculine because he's being the primary caregiver than somebody who works full-time, you know, in like, you know, some kind of role that we find very masculine, you know, being a firefighter, something like that. And so one of the struggles some of us as parents and educators have is when we have a child who expresses a desire to have a gender identity or to express their gender in a way that doesn't match our religious beliefs. And we have to have that discussion of, is it because our individual doesn't understand? Is it because they are exploring what that might mean or what that might look like? Or is it something that intrinsically they feel very strongly about? And one of the tools that we're going to talk about here in a little bit is how do we enable them to communicate those thoughts and desires to us as the adult that's working with them? And then another circle is recognizing sexual health and reproduction. And this really focuses on those attitudes and behaviors regarding health and hygiene, maintaining cleanliness to prevent infection, maintaining safety practices so that we don't transmit diseases. And then, do we have the capability of understanding the consequences that might be a result of those sexual intercourse, sexual interactions? Okay. So it's really important to understand that young teenagers, young adults with autism are going to have the same sexual urges as anyone else at their same age. But how is he or she supposed to find any frame of reference for them, any mental construction, let alone an outlet, if we deny them a voice in that role? When we deny their sexuality, we are denying them the opportunity to be the fullest person that they can be. Sex makes us who we are to a huge degree. It's how we identify with our tribe, our friends, our potential mates. And it also influences the type of lifestyle that we want to live long-term. So we got to teach it. And if we want statistics about why we have to teach it, here they are. In the US, we have one of the highest teen pregnancy rates throughout the industrialized world. We have more than 750,000 women ages 15 to 19 who become pregnant every year, and 80% of those are unintended. People ages 15 to 25 make up 1/4 of the sexually active population. Half of the sexually active population will contract a sexually transmitted disease. We have a pressing need to address harassment and bullying and relationship violence. We have to teach individuals how to say no and how to get out of situations they no longer want to be in. Okay. And so here are those national standards, okay? The National Sexuality Education Standards, and they were developed for grades K through 12. They do include health, so just overall health well-being standards, but they also age appropriately start to dive into actually teaching that sexuality and those sexual activities and how you maintain safety within them. Okay, so here are some examples. We have a core concept, being able to comprehend concepts related to health promotion and disease prevention. Analyzing influences, understanding the influence of family, peers, culture, media, technology. Can we access valid information? Do we know how to get on the internet and figure out what's valid or what's not valid? Do we have an adult that we trust enough to disclose what's going on in our lives to be able to get help to get to these standards? Okay. And we want individuals to be empowered, that bottom standard advocacy. We want students to feel like they can advocate for what they want and what they need to be the fullest part and being of themselves that they want to be. And this is just kind of what it looks like. And if you choose to dive into them, the link to them was on the previous slide. And this gives you a little bit of information about how those standards are laid out. And then this breaks down those concepts, and this very strongly mimics those circles of sexuality that I was showing you earlier. You know, in human development, we're looking at puberty, reproduction, body image, orientation. If we're looking at relationships, we're talking about families, friendship, love. What does it mean to be romantically involved or dating? What is marriage? What is a lifetime commitment? What does it mean to raise a baby? Okay, so it's more than just sex. It's all the things that go with it. So ultimately, we want kids to understand how to get accurate information, how to question, explore, and figure out who they want to be, how to experience those things in a safe way, and then how to ultimately be responsible as a sexual being. That's our ultimate goal. Okay, so how do we get there? How do we help them? What kind of strategies can we use? And full disclosure, some of these might make you uncomfortable. And that's okay. I want to make you a smidge uncomfortable because I want you to realize that there are tools out there that you can use that make things more concrete, that clarify the conversation that we're having, even if they make us uncomfortable. I have a early teenage years daughter, and we are having to have some of these conversations as we start to see friends having boyfriends and boys and girls that are sweet on each other, and what is flirting. And I'll admit, you know, I have a typically developing daughter, and some of these conversations are very uncomfortable. And some of these conversations are even more uncomfortable when you involve mom and dad. So part of the struggle is going to be figuring out who in your household or who in your friend group, family group, does the child have the best rapport with, and who has the ability to confidently and comfortably have that discussion together with that individual to give them the tools that they need to be successful. Okay, so here we go. So first things first, we have to teach anatomy from a very early age. We have to teach correct names and commonly used names, because if we only teach one or the other, then we're going to run into struggles when we are in the peer group setting. We want to be sure that if Johnny is talking about, you know, his ding-a-ling, that Susie over here understands that ding-a-ling is not a fidget toy, you know, that we're talking about his penis. And so you have to be sure that we're teaching all of it. To give you some examples of the different types of sexual language I'm referring to, you can look at the top right-hand side of your slide. You know, the formal or polite word for the female anatomy is the vagina. That's the medical term. The technical terms are you have a labia, you have a cervix, you have a clitoris, you have a vulva. The cute terms that you're likely to hear in middle school are going to be vajayjay, muffin, you know, you got a little man in a boat, you got a punani, you got lady parts. But then you've even got the slang terms. You know, you got a snatch, you got a beaver, you got a twat. There's all kinds of them. And if we only teach one set of words exclusively, then we are setting somebody up to be at a disadvantage when somebody is using those terms in a different setting. So one of the things that often comes up is joking, and the flirtatious joking that starts to happen in middle school and continues into high school. If I, as an individual with autism, don't know some of those slang terms, I may be laughing at a joke that's being said by a classmate, giving a impression that I am in agreement with, or I am in favor of something, but I don't understand what it is that I'm agreeing to. And so one of the ways that we prevent students with autism from getting into situations that they're not equipped to be in is by teaching them the language that they're going to be exposed to. Okay. Down at the bottom on the left-hand side, you can see a website called Teach-A-Body. The two little dolls that you see are anatomically correct dolls. They allow you to physically manipulate something to show those parts. You know, we have a whole spectrum of autism. And so we're going to have individuals who need very concrete items to be taught with. And then others that are going to need, you know, a little more abstract. And so I've given you some examples. The two puzzles are anatomically correct puzzles that can be purchased off of Amazon. And the bodies come from teachabodies.com. And again, these can be used with very young children, just beginning the conversations of these are your body parts. We can start having those conversations very early on about what is private and who can see private parts when. Okay, so what's public? What's private? What kind of activities can I do in each of those settings? And so you'll see on the left, this is a matching activity that was used to teach this. These are manipulative and the pieces come off. And so the individual with autism was given a bag of cards and they had to sort, okay, breasts would be considered private. We don't share those with just everybody. Semi-private might be a shoulder. Again, your religious practices might influence some of this. Are you comfortable allowing somebody to see your shoulder, the top of your torso, or are you somebody that considers that to be private area and needs to be covered? Okay, how much shoulder can be covered? And so you as adults have to have conversations in your family about what do you consider private, semi-private, or public? And then what are those settings? My bedroom is a private place. My bathroom is a private place. But then I also have to take that a step farther and also teach sometimes going to the doctor, and the doctor is allowed to see some of these private places. So for your females, you know, you're going to be going to a gynecologist once a year for a checkup. They're going to check your breasts. They're going to do a full exam. And so we have to make sure that that doctor's built that rapport with that individual, and we're doing some kind of activity with them ahead of time to let them understand that this person is okay in this location to see these body parts. Now on the right-hand side, you'll see a social story, a clip of a social story where we are lining out what does it mean to be private and what does it mean to be public. Well, private parts are those parts that are covered up by my underwear or my bra, my swim trunks or my swimsuit. Okay. Another example, these are made using Boardmaker from Mayor Johnson. And so, yes, so I see your comment. Even with my oldest neurotypical child, I worry about exposing info too soon and ruining the innocence. I completely agree. I am navigating this road right now. And honestly, with my child, I have found that I can bring up a topic and watch her reaction. And if it's immediate, oh, mom, then I know maybe it's time to back off a little bit. But a lot of times I get and you can tell there's a moment of, hey, I might have heard something like this in the locker room, or I've seen or heard this from a friend group. And I take a lot of cues from my child as far as how quickly or how in depth I go with topics. And I'll be completely honest, even with my neurotypical children, I use a lot of the visual supports that I've learned working with individuals with autism, because I can take something like this social story concept, and leave it on the table, the kitchen table, and my kids are curious about it. And so they're going to stop and look at what it is. And typically, it's a way of exposing them to the information without having that initial conversation being quite so uncomfortable. But then if I've piqued their curiosity, they're going to go, hey, what is this? What are you using this for? And so I've used a lot of social stories like this one and some other things to help be conversation starters, even with my neurotypical kiddos. Now, to go right into that, one of my favorite books is called Making Sense of Sex, and it's by Sarah Atwood. And this is probably my favorite page in the whole book, but it is an excellent resource. It goes all the way from when our bodies start to change, even those changes that are occurring before we go into full puberty, all the way through puberty, all the way through flirting, having relationships, to getting married, to dating, and to having babies. It is written like a giant social story. So it's very straightforward. It's very to the point you're not having to kind of dig through all of the excess language to get to the point. But we've also used some of this just a chapter at a time. I'll photocopy just a single chapter that's applicable to what we're doing right now. But it's laid out really well, and it's a great conversation starter for my neurotypical kids. But for my kids with autism, it's cut and dry. It's straightforward, like this chart. And so for those kids who don't need all that excess information, they want a roadmap, A to B to Z, all the way down through. This is a fantastic tool. Now, you can make your own. You can sit down and take an idea starter like this and think about, okay, in our family, what does it mean to flirt? Okay. I will say to this one, there are some things that I would add that would be applicable today that weren't even applicable just a few years ago with flirting, is taking half face pictures. The kids that I work with now, we'll do something called Be Real, and it's kind of like a Facebook, but you can only post one picture a day. And if there's a boy you're interested in, then you text pictures back and forth. It's not even conversations, it's pictures of things. And so don't be afraid to have conversations with the teenagers around you of what are you doing, in different situations. How do you see people that you go to school with showing that they like each other? What's first base considered now? What's third base considered now? And so that you know what is out there, what your kids are going to be exposed to, but that then you are also then filtering that through what your belief system is in your household. Just checking that chat real quick. Okay, so this is a great resource for you. Now, another example is to use graphic organizers. You know, we talk about graphic organizers for academics all the time, but what about taking different sexual feelings or sexual interactions and putting them into some kind of a graphic organizer? Well, if I'm a very black and white person, like most of our individuals on the spectrum are, what is flirting? What can I, without a doubt, pretty reasonably say is flirting? And what can I say is not flirting? And then where might it be kind of gray area where we're really friends, but we're not flirting? And so, you know, things like laughing. Am I laughing at you? Am I laughing with you? Am I laughing beside you? Are we laughing at something in a mutual conversation? And so to me, the things that are in that overlapping gray area are the things that we know that we have to really hone in on. And we're going to have to do things like write a social story. We're going to have to role play with somebody of the opposite sex so that we can see what they actually look like and what they feel like. Where do I struggle when I have those role plays with the opposite sex? That then tells me what else I need to do to practice those skills towards mastery. Okay. Now, April Keaton came up with something called the relationship pyramid. And this is a way to help individuals with autism and other disabilities to understand the difference between acquaintance, somebody I'm friends with, and somebody who is my spouse or my significant other, and what types of activities would occur with those different social groups. Stephen Shore, you know, brought up the different circles, the intimacy circles. This is another way to look at it. This one is a little more linear, more dry, clean cut for those individuals that need a little more precise boundary between who falls into what group. Okay. Now, something that those with autism are going to struggle with, and even those of us who don't have autism struggle with today, is how do some of the cultural things fall into that? For example, some of our Asian populations don't make eye contact with certain individuals, or those who are of the Islamic faith are not necessarily going to interact male and female the same way somebody who has been raised here in the United States might interact. And so if we have an individual with autism who expresses some kind of interest or desire in somebody who might have some cultural differences, then we have to go a step farther and investigate those cultural practices to make sure that we are teaching them what they will need to be respectful in those cases. Okay. Now, one of the topics that always comes up and that nobody wants to talk about because it makes us all very uncomfortable is that of masturbation. It is a normal topic. It is a normal experience. Babies begin to explore their bodies. And as they age, they learn what feels good and what doesn't feel good. I can remember being a fairly young teacher and having a parent, I was teaching high school at the time, having a parent who came to me and she said, "We know he's trying to masturbate because we are finding it on things. And now the new issue is he has a urinary tract infection we can't get rid of." And so they went to the doctor, they would get medicine, they'd end up back at the doctor, back on medicine. And the issue was he was doing it wrong. So he was infecting himself by being too rough and causing tears in the skin. And so it was the first time somebody had come to me and said, you know, I don't know what to do with this. And I had to say, you know what, this is a new one for me. And so I went home and I looked at my husband and I said, how do you learn to do this? You know, is it just innate? Do you learn from somebody else? You know, how do you do this? And so we problem solved. I did a bunch of research and I came back to her with an answer. But then the new issue was, how do you clean it up? Okay. And so for those of you that are still hanging with me, I'm going to pause for just a moment. How do you clean it up if you're a boy? Do you know? Is anybody going to be brave and respond? Anybody? No clue. That's an honest answer. It's a dirty sock. And when I got that answer from my guy crew that I, felt comfortable asking, they said, when your mom comes into your room to gather up your laundry, she just grabs the socks, throws them in the basket. She's not messing with them because socks and underwear are inherently kind of ew. And so you use a dirty sock, you make sure the socks turn, the right way so that you turn it wrong side out, you clean it up, you turn it the right way, you throw it in the laundry. It goes straight to the washing machine. Nobody's ever wiser, and I thought, I would have never thought of that. And so me as a female teacher would have taught it wrong if I had been trying to teach that scenario to a student, because that's not what the boy group would have been discussing or experiencing. And so I would encourage you, to ask your spouses, ask your close male friends questions when you aren't sure about what is normal boy behavior. Okay. Now, in some cases, we may have to actually teach somebody how to do this. Several years ago, there were a couple of resources published, one called Fingertips and one called Man-Made Love. And they were both books and videos that somebody could watch to learn how to do correct masturbation. Since then, we also have some companies I've got your resource down here at the bottom of the screen, who also sell anatomically correct models made out of silicone that somebody could use to teach correct manners of masturbating. But these are also very beneficial if we are having an issue with hygiene. If we're not understanding what it means to wash all of the parts, to wash well, we may have to actually use something like this to teach the skill. And using a model like this, yes, you're going to be embarrassed. Yes, it's hard, but it prevents you from being in an uncomfortable situation where you're trying to teach it on somebody that maybe we don't want to be that close to. Okay. If I have an 18-year-old son, I may not want to teach on them. I need a model. Okay. How do I best explain my son with ASD that masturbation is normal and okay? I think that that's a great place to use a social story. And to let them know that everybody has those sensations. And then I think a model like this is how you teach clean, how you teach how to clean it up. You use a visual task sequence of what you do in the correct sequence of where to touch and how to clean it up, and then how to clean your body when you're finished, so that you are not potentially infecting yourself. Yes, we've also used short clips from TV shows. And you can also, Peter Gerhardt, if you've ever heard him speak, he will pull pictures off of the internet. And it might be, a guy and a girl on a couch, and they're still clothed, but they're obviously in an intimate relationship. And he uses that as a conversation starter of, what are they doing? And it's very interesting, the type of responses you get, like they're looking for crumbs, or they're cleaning the couch. And so, using images and short video clips and physical models to teach with that visual schedule of, you know, we're going to touch here, we're going to rub here, you know, we're going to feel this sensation. This is how I'm going to clean it up. And then this is how I clean my body and my space to prevent infection. Okay. Now, one of the things we also have to remember when we talk about this topic is we have to teach where it's okay. You know, in the case I was describing a minute ago, they had taught the young man that the bathroom was okay, but the problem was we use bathrooms everywhere. And so we got into a situation where bathrooms were okay when really it wasn't bathrooms, it was his house, his bathroom. And so a lot of professionals will encourage you not to teach the use of a bathroom for that purpose, that it's only their bedroom for that reason. We also have to teach rules for when you can do it, when it's appropriate, when it's not appropriate. And in some cases, for some individuals, we have to build that into their schedule. Okay. If they are very routine oriented, then we're gonna build that into their schedule. Now, if something goes wrong and we have to reteach something, we can't overreact. Because if we're overreacting, then we're making it taboo and we're creating a whole new set of issues that we have to deal with. Oh, I went too fast. Okay, another thing that we might have to deal with is we may have to think about when are things okay. So this would be an activity that I might do with an individual of when and with who is it okay to do different activities. So is it something that I would do if I'm married? Is it something I would do with a new person that I'm dating or I'm interested in? Is this something I can do with people that I'm casually dating? You know, maybe somebody I've met on the first date or the second date. And again, this is one of those, what does your family's religious or ethical standards set as a code that you want to teach your individual to live by? And so for me, I would cut the titles along the right-hand side of the screen apart and put them on cards and cut all of the individual picture symbols apart. And I would use those, and I might only use 2 or 3 at a time, but with who would I do those? I could also make a Venn diagram like I showed you earlier of, you know, is this something that I would do alone, somebody I would do with somebody, or something that I might do in both situations, okay? But these again are from Boardmaker. Boardmaker does have sexual images that you can include when you are installing it. It will ask you whether or not you want those to be included. And so you may have to go back and click a button to access those. But I really like Boardmaker because it is standardized and we don't risk you know, it's hard to go to the internet and type anything in now where you don't get a wide variety of photos that may or may not make you uncomfortable. And so, you know, using a piece of software that's specifically dedicated and intended for this purpose allows you to get the symbols you need without having to hunt through the variety of things that you might find just Googling a phrase on the internet. Okay. Now, again, social stories were originally created by Carol Gray. They are fantastic tools. These are the titles to 3 social stories that you can access on a website called Living Well with Autism. She has a number of them on there, but they're pre-made. You can download them. They use the Boardmaker symbols. And so this is another resource that you can use, but you can certainly write your own social stories. Taking a little bit of time to explore Carol Gray's website gives you the information that you need to become your own author for the situations that are particular to your individual with autism. Now, this is one of my new personal favorites. A lot of schools are using this concept of the 5-point scale And they use it in terms of volume control, how loud you can be in certain situations. And so for a lot of our individuals, this concept of a 5-point scale has become very familiar to them. And what we've done with this is we've taken, a behavior that somebody can engage in, and how does it make the other person feel, and what can I do in that situation? So for example, if I'm staring at somebody and I use any kind of a gesture that might offend them or scare them, which is a level 5, and I'm going to need to apologize. Whereas if I see somebody cute and I look out of the corner of my eye at them and they don't notice, I can go back to what I'm doing. Okay. So it outlines some of the more discreet, some of those discrete social behaviors that are harder to master. And these are hard for typical kids to master. We all struggle with them sometimes. Okay. So it's a great way to make it visual. And I could put any kind of behavior into this kind of chart for teaching purposes, and then we could practice it. Okay. Now, one other thing that's really come to light, and we're getting close to being time, is the critical skill of saying no. There's been some research in recent years that talks about one of the reasons why individuals